Good morning, everyone. Welcome to the Food Safety and Defense Conference 2022. This is our 11th year. Y'all can fill up. Y'all can come up. Y'all ain't got to be all the way in the back. We ain't gonna bite. I'm Joyce Moore. I'm Supervisory Sanitarian with the DC Department of Health Food Division. And this conference is made possible by an FDA science conference grant that we apply for every year. So thanks to them, we are able to put this conference on every year. We were even able to do it virtually in 2021 during the COVID time, just so that we didn't lose contact with the public, to let them know that we're still here, that we are still, out there keeping the residents and the visitors of District of Columbia safe. We have continental breakfast out front if anybody wanted some coffee, muffins, croissants. The bathrooms are, as you go out the theater, they are to the left, and you hang a quick right. You have restrooms right there. For lunch time, we have in the area, I believe it's a Potbelly, it is a Subway, and I think Giant Foods has a hot bar as well. Also, I think in the next block, it's a pho place to go to for lunch, if I'm not mistaken. So we got a pretty packed-filled day. We have Kenya Moon here from FDA. We have Mr. Sharad Bach. He will be speaking on social media and food safety. We have Mr. Dr. Anil Mengla. He will be speaking on monkeypox. And then right before lunch, we have Dr. Lewis. She will be presenting the Director's Award for those businesses that have worked hard throughout the year to get excellent inspections. After Dr. Lewis, we will be bringing on Stephen Mandernack. He will be talking about future trends, food safety culture, and food safety goals. I'm sorry, before lunch. After lunch, we have Dr. Darren Detwiller. He will be virtual. He will be speaking on how food safety has evolved. And after that presentation, we can go out to we set up breakout sessions. So we have a breakout session upstairs in the lobby, and we have a breakout sessions next door. And we'll be talking about a whole host of things like how to pass your inspection, rodent proofing your business, getting a vendor/basic business license, food safety risk factors, plan review, and understanding the new food safety online portal along with shared kitchens. I have a Victoria Grover.
Good morning, everyone. Hope everyone is doing well, feeling good this morning. So my name is Robin S.P. Harlan. I'm a sanitarian with DC Health Department, and I have the pleasure today of introducing our speakers. First, we have our program manager, Victoria
collaboration with our internal sister agency, as well as with our Rodent and Vector Control Division and other district government agencies. We recently hosted the National Food Safety Authority Egyptian delegation. We are looking to update our food code in the near future. And we continue to work in collaboration with our local, state, and federal food safety partners. We have had staff retire and depart to advance their public health careers. However, we have also onboarded 5 sanitarians, a staff assistant, and a food technologist. We are currently recruiting to fill sanitarian positions within the Division of Food and Division of Community Hygiene Programs. I am pleased to announce that we have moved to an online application process, and you will hear more about that later on this afternoon. Lastly, I would like to acknowledge all of the hard work that the Food Safety Task Force has put into planning and executing this conference. Thank you again for joining us today, and have a great day.
Next, we will have Mrs. Kenya Moon. Kenya Moon is a retail food specialist for the U.S. Food and Drug Administration. Based out of Falls Church, Virginia, she is responsible for assisting retail food safety and food defense programs of regulatory health agencies in Delaware, the District of Columbia, Maryland, and Virginia. Prior to joining FDA, Kenya was the training supervisor at Cobb and Douglas Public Health in Marietta, Georgia, and later was quality assurance specialist for a third-party auditing agency. She is a graduate of Auburn University with a bachelor's degree in biomedical science and is a huge college football fan. Please join me in welcoming Mrs. Kenya Moon.
Good morning. Can y'all hear me? Morning, morning, morning. I think we're trying to, I see slides. Yes. Thank y'all. We were having technical difficulties, but I think we have it. Well, good morning again. I'm super excited to be here, and I'm going to try my best to get through this quickly. But I told them jokingly this morning, there's not too many folks that are special enough to get me out of my house to present in person. So I've gotten used to the COVID presentation of what I call business casual, definitely when where you're professional on top and then the bottom you got jogging pants on and all that type of stuff. I had to put on real pants today, but it's all good. We're here. Super excited to be speaking to this group today, so I will jump right in. And what's on the agenda is not what I'm going to talk about. I'm going to talk about norovirus and a little bit of FDA, tell you about what's been going on at FDA. So if any of you were in attendance last week, we had our food safety, our retail food seminar. Normally those seminars are face-to-face. For the past 2 years, we've had them actually virtual. We're excited for 2023. We're actually going to go back to having them in face-to-face. But the theme of this year's seminar was employee health and norovirus. Now, these numbers that you see on the screen are probably something that you've probably heard before. This was from a study the CDC did about probably 10 years ago now. From what I hear, the numbers are still accurate, probably a little higher even. But they say foodborne illness causes 48 million illnesses annually in the U.S., causes 128,000 hospitalizations and 3,000 deaths. So let's talk about that a little bit as it relates to norovirus. Why are we pushing norovirus? Why is everybody always talking about norovirus? Well, right now, norovirus is the #1 cause of foodborne illness and outbreaks, and that according to CDC data. At the end of this presentation, and I'll also provide it available to you all in PDF format, there's a link. You can look at that study that the CDC put if you want to see more in detail. But we know norovirus is our #1 cause of foodborne illness and outbreaks in the U.S. A few years ago, if you're keen to your food safety illnesses or whatnot, it was salmonella. Now norovirus has kind of taken that #1 spot. Number 4 in hospitalizations. Now this is pretty interesting. It's number 4 in total hospitalizations, not just foodborne illness related. So norovirus is up there, number 4 reason most people get hospitalized. And it's unfortunately number 5 in deaths. So this is total deaths. So norovirus is one of those bugs where generally most people don't think it's too bad because, you know, most people that are fairly healthy, they get noro. They may have a little vomiting, a little diarrhea. That's about it. There's nothing major for most folks. But some people do get severely sick, severely dehydrated. They have to be hospitalized, and some unfortunately even die. So noro, you're like, okay, why is this FDA person talking to me about noro? Well, one of the things that FDA is pushing this year, or all the years, is we're really keen on employee health, because this is one of the things that we as regulators, as operators, business owners, food workers can actually try to prevent. So we know norovirus is number 1. So what is this data? This is also data pulled from that CDC study they did. Where is norovirus happening? Well, for you smart folks out there, you see 64% of norovirus outbreaks happen in restaurants. I don't know if it's surprising to you all or not. 17% catering types like banquets, weddings, things like that. And then the other 19% will include like schools, grocery stores, things of that nature. But the majority of our norovirus outbreaks are happening in restaurants. Okay, so what do we do with that information? We know it's happening. Why or how is it happening? Most of the 70% of the norovirus outbreaks that happen and occur actually can be traced back to an infectious food worker. So that goes back to one of those big, we'll talk about risk factors in a second. So employee health is really big in FDA Food Code talks about. It's a whole chapter 2 on employee health. We have all these annexes on how to restrict and exclude employees from work, because 70% of these outbreaks can actually be linked back to an ill food worker. Of those 70% of the outbreaks that happen, we know that 92% of the food happens, it gets contaminated at the point before it's served. So in essence, it's basically ready to eat food that has been contaminated right before it's served. So that 92% is kind of a high number, 70% is a kind of high number. And if you think about that, if those of you that know about the food code, and a lot of you in here are regulators, sanitarians, and you're also employee operators and managers, owners of restaurants, think about some of the procedures that are in your establishment. Think about what the food code tells us. If we were to exclude and restrict employees that were sick and ill, they wouldn't be in the establishment to potentially contaminate food. We also have another thing that we can do. If those folks are not using bare hand contact with ready-to-eat food, we could also prevent that norovirus from happening. So that's my challenge to you all. As food safety personnel, professionals, owners, operators, managers, regulators, let's think about our employee health. And I challenge you to train your employees. I challenge you, sanitarians, when you go in there, talk about employee health. See what employee health practices are in place and procedures are in place in these establishments, so we can possibly prevent these foodborne illnesses from happening. All right, now I'm not trying to bring everybody down, but foodborne illness risk factors, top 5 things CDC tells us, we know these are the things that prevent or that cause foodborne illnesses. Improper holding temperatures, inadequate cooking, contaminated equipment, and food from unsafe sources, and poor personal hygiene. So the smart folks in the room will see, okay, we got one at the bottom that's in red. So you're like, Kenya, why is that one in red? So think about what I talked about, norovirus. Poor personal hygiene is the cause of norovirus outbreaks. So that's why that's here. So what's the food code tell us to do? We know we got poor personal hygiene. Well, how can we as an operator or as a sanitarian, when you're going in there to do your regulatory inspections, how can you help folks not get norovirus outbreaks? Fairly simple. If you're familiar with, some of you may have be familiar with one of our training officers, well, she's now the director of training at OTED, Office of Training, Education, and Development, Janet Williams. She has a saying when she teaches a class. She says about hand washing, people need to wash their dirty, stinking, nasty hands. So I'm going to take Janet's words and I'm going to say wash your dirty, stinking, nasty hands. That's number 1. You want hand washing. Hand washing is key. There's an article I read a couple weeks ago from a university put out a study. You know, when we were in the midst of COVID and pandemic, we kept hearing hand washing, sanitizer, hand washing, sanitizer. And I work with a state that actually tracked their norovirus outbreaks. During that 2-year period, they had 0 norovirus outbreaks. Then as people slowly got back into the world, And we stopped hearing those hand washing messages. It was not at the forefront of our mind. Now, this is my opinion, but it wasn't in the forefront of our mind. They slowly saw their norovirus outbreaks uptick again. So hand washing, we know, is key. What also is key, food code tells us exclusion and restricting those ill food workers. If someone has symptoms, the food code lines out what symptoms food workers should be excluded from, when they should be restricted. So if you're unsure of how to do that, and I'm sure DC Health has plenty of handouts they can give you as well, check out chapter 2 of the food code, check out the annex, and it will actually have a flow chart. You can pinpoint there and it'll tell you if a food worker should be excluded from the establishment or if they can be restricted. Restricted basically means they can come to work, but they can't do any food prep duties. So maybe they can, clean up in the back or something like that, but you don't want them actually directly in contact with food, because if they are shedding noro, you can potentially contaminate food and make people sick and have outbreaks. And also the third thing that we can do to prevent these norovirus outbreaks, that's a part of poor personal hygiene or personal hygiene itself, is to have no bare hand contact with ready to eat foods. I like to think of this as not a glove rule, it says no bare hand contact. A lot of times people like to use gloves as catch-alls. I don't like that, because think about it, if you got gloves on your hands, you go to clean up something, 9 times out of 10 you still got those same gloves on your hands. So you want to change those gloves, wash your hands. So really it's better to think of it as not a glove rule and not say, oh, put gloves on, put gloves on, put gloves on. No bare hand contact. Can you get a utensil? Can you get tongs? Deli paper even, to touch the food product instead of your hands. It's not always, gloves is not always the answer. I like to tell people that. You're like, oh, FDA said that. And you don't always have to have gloves on. It's a no bare hand contact rule. That's the key. No bare hand contact. So these are the 3 things we want to have in place to prevent those noro outbreaks. Exclusion and restricting of ill food employees, proper hand washing, no bare hand contact with ready to eat foods. So if y'all didn't hear me say anything else today, please take away one of these things and you'll be good to go. All right, so I mentioned earlier there's a couple of things FDA does have in place where will help you guys as operators and even as inspectors and sanitarians on how to determine when an employee should be excluded or restricted from work. There's the Employee Health Hygiene Handbook, and like I said, you'll be provided with links probably by email of these items. You can download this handbook. There is a form on there where if you hire a new worker, they can read the symptoms that they should report to you guys as managers. And then there's illnesses on there that you as the health department are required to get, or you guys are required to contact the health department and let them know. All of that's listed in that employee handbook. So that's a good resource for you all. All of this stuff free of charge. We also have some industry outreach materials that have been developed. This is posters and handouts that basically, some of them have words on it, but you notice there's very little words. And I can basically, well, the words are too small, so I can't read it from here. But that first picture, I can basically look at that scenario and I can tell what's going on. I know it may be kind of small for you to see, but the first photo, top left, the young lady's in the restroom, hurled over the toilet. She's probably vomiting. I can get that. Okay, so she's sick. So should she be going back to work? Probably not. And then you can tell she's sick, so the third picture, she's taking her hands. You may not be able to see it, but there's no tongs, no utensil, nothing on her hands, so she has bare hand contact. She's putting some chips into a container, and she is serving it to a table, and then the little boy gets sick in the hospital. So my 4-year-old can look at that and tell what's going on, and he can't read yet. So those are good pictures and things like that that are short to the point, let people know, hey, this is what I need to focus on. And these posters were actually developed out of a focus group of food employees. Like the young lady in the focus group was a food operator in the Atlanta, Georgia area, and this was their idea to actually do the posters like this. So pictorials and things like that go a long way with training employees. That's just a link to those materials I spoke about. Active managerial control. Here's another challenge I have for my operators out there. We at FDA hopefully we want everyone, and you guys are probably not the audience to speak to because you're here because you're getting a director's award. So congratulations on that. But active managerial control, basically the true definition means that it's the purposeful incorporation of specific actions to attain control over foodborne illness risk factors. All right, so what does that mean, Kenya? Basically, it means you know what risk factors or what hazards you have in your establishment as it relates to food safety, and you have procedures in place to control those hazards. I like to when I go out and I'm standardizing a sanitarian or health inspector, I like to think of it this way. They're only in there two, maybe three times a year, depending on how risky of a food safety processes you have in your establishment. You all, as the person in charge, the owners, the operators, you and your food employees are there from the time that restaurant opens to the time it closes. So it's better for you all to have the active managerial control over those risk factors than to depend on when you're coming in for your sanitarians to come in and do the inspections. That should be just a check for them to come in and make sure that things are working properly. They're kind of monitoring, kind of see if there's any gaps we need to work on, what we need to educate you on today. But you guys, active managerial control, FDA is all about AMC, or active managerial control, because you're where the magic happens. You want to get food safety, think about food safety as being preventive rather than reactive. Because if an outbreak happens, what do? We got to go in reaction mode. We got to find out what got them sick, what's the food product, we got to test samples. But if we're being in preventive mode, we can prevent those outbreaks from actually happening. All right, a part of AMC, I like to say, is food safety management systems. It's just another way of saying AMC. It's a little more kind of in depth because food safety management systems involve procedures, training, and monitoring. So what procedures do you have in place? And I like to say with this, it doesn't necessarily have to be something written down. When I started my public health career, I started in the rural county of Atlanta, Georgia. So I had county places that were like way off the beaten path. And one of those places had probably one of the best non-written food safety procedures that I'd ever seen. Everybody in that establishment knew what those risk factors were. It was a chicken place. They knew they had to focus on salmonella. They knew about washing hands. They knew about no bare hand contact. They didn't have anything written down, not one temperature chart in that place. But I could go in there and quiz almost any employee. They could tell me what symptoms they need to stay home with. They could tell me it was 5 at that point. They could tell me those big 5 illnesses. They knew. So it doesn't necessarily have to be something depth and pretty and written down, just as long as you have the knowledge and that you're training your employees on your procedures that you've set forth in your establishment. And then following up, monitoring to see if those procedures are being followed and to take a look at them periodically from time to time. You want to check your procedures to see if anything changed. If you had changes in your menu, well, maybe we need to add something else to update our procedures, things like that. So it should be periodically monitoring and checking as well. All right, that's my spill on Noro. So like I say, I wanted to throw that in there real quickly before I get into some FDA updates. And because, like I say, our seminar last week, we had a big focus on employee health in Noro, because that's one of the big initiatives that FDA is doing. We're going after employee health because we see, as we're going in the field with folks, it is underrepresented. It's not assessed as fully as we like, and we know that these norovirus outbreaks are on the uptick. So we're hoping in a few years we'll have them going down as people get more aware on these intervention strategies and ways to prevent these norovirus outbreaks from happening. All right, so what else is going on with FDA world? This is mainly for any of my sanitarians or environmental health specialists in the room here. Most of you should be aware of Retail Flexible Funding Model. I know DC has a few grants and things that you guys have applied for with FDA. The portal is now open to apply for more funding, so it's open till October 12th. If you haven't gone in, you need questions about your application, you got ideas about projects, call me, send me an email, and we'll talk about and see how I can help you with that. So I'm going to go through all of that in depth because you'll have this. Other things that are happening training-wise. We are really pushing also program standards. For those folks in the room that may not be aware of what the retail program standards are, FDA has what we call 9 retail food program standards. And these standards are what we think would be the optimal health department if they had all of these, if they met all of these standards. So for our enrollees of those 9 that are enrolled in the program standards, and DC Health is enrolled in the program standards, we're offering 2 virtual instructor-led workshops that will help you with your self-assessments and your verification audits of the standards. The virtual ones are in January and in March. We're going to also offer 2 in-person seminars or classes, and one will be in association with the AFTO conference, which is actually going to be in Norfolk, Virginia this year or next year, and then also the NEHA conference is going to be in New Orleans in July. So those are 2 in person. We're going to have 2 virtuals, and then we're also trying to get out there to get everybody. We're doing self-directed guided modules. So you can go online at your own pace and you can work through the standards, get how to do those self-assessments, verification audits, and there's also online self-directed modules. Any questions about any of those, y'all know how to reach me. What else is happening in 2023? So CFP, the Conference for Food Protection, is going to be in Houston next year. And CFP is, we have regulators that are there. It's state, local, federal, so FDA, USDA, anybody regulatory will be there. Also consumers, so general public can come. Operators, we have big industries, big representation at CFP. CFP is where we all come in to talk about new developments or new things that may need to go into the food code, or maybe something we need to tweak and change about the food code. So the FDA food code is actually developed out of what the talks and stuff that happen in the Conference for Food Protection. So CFP is going to be in Houston in April of next year, and it is planned to be face-to-face this year. And then I already spoke also, we're going to do our retail seminars face-to-face. I don't know yet where the one is. It's going to be closest to district, so once I find out where that one will be, I'll let you all know. All right, quickly, I'm going to talk about New Era quickly. New Era Smarter Food Safety. Most of you have probably heard something about FDA's New Era of Smarter Food Safety. What does all that mean? There are 4 core pillars for New Era. Tech-enabled traceability, which will help us with like the produce and any outbreaks, that aspect of it. Smarter tools for outbreaks, getting more kind of techie or online type of things for helping us with during our outbreaks. And then new business models and retail modernization is our 3rd core, and then food safety culture. So retail food, which is us in the room here, we are really big on core element 3 and core element 4, which is our new business models and retail modernization and our food safety culture. So food safety culture is that environment that you're creating in your establishments, that environment that we're creating in our health departments, to where food safety is at the forefront of our minds and it comes natural. That's kind of what food safety culture is. What is the culture of your facility? Is it a food safety culture? What's the culture of your health department? Is it a food safety health department? You may think it's a health department, it should be. Not necessarily. Some of them are all checklists. I gotta do this, gotta do that. Floors, walls, and ceilings mentality, I like to think about it. Risk factors is where the magic happens. You wanna focus on those risk factors. And then new business models deals with things like from our delivery places, like our DoorDash, our Uber Eats, our Home Chef, things like that, where direct to consumer may not necessarily come from a restaurant. It can, but that restaurant food may go to this warehouse, they pack it up, then somebody else comes gets it and takes it to my house. So we're kind of looking at that. And who owns that last mile? That's what FDA is trying to help, in conjunction with USDA and a couple other folks, trying to help figure out, because we're getting a lot of questions from regulators on, how do I regulate this? You know, I may have this restaurant that I permit, but they're taking orders from this warehouse, the food goes to the warehouse, and then nobody else checks the food, or what's happening with it. So we're trying to help you all with that aspect. So there was a summit, a conference in October of last year. It was done virtually, but it was attended by industry, it was regulators, consumers, where people came in and they talked about their procedures and things they had in place to kind of help you guys to learn how to regulate these. Hopefully we're gonna put out something soon as a result of that conference, so stay tuned for that. But this was just a slide just to show what's happening now. Those of you probably know, since COVID, grocery online delivery sales have like skyrocketed. There's guessing about 20% of people now actually only buy their groceries online. I mean, I'm one of those. I don't have time to go to the grocery store. I'll order it and it'll come to my doorstep. So that's getting more common now, even in places where online delivery was not prevalent. And there's projecting that by 2023, it's going to be over $100 billion industry for online grocery business, period. So just to summarize that, FDA is looking to modernize our food safety system. We want to get more tech traceability type things happening. We want to focus on those risk factors. We want to focus on those food safety management systems and focus on those food safety behaviors, getting that food safety culture in place, because that's where we know it happens. It's easy to go in and say, this food is out of temperature, throw it away. But it's harder to change somebody's behavior and think, okay, if I'm sick, I've got vomiting and diarrhea, I know I got my bills to pay, but I don't really need to go to work because I can make somebody sick. It's hard to change that behavior change. And that's something that we want to work with you guys as industry and also you as regulators to hopefully come up with a common ground medium so we can stop some of these outbreaks from happening. And that slide, and that's it. So thank you. I went through that like a mad woman, mile a minute. I don't think I had time for questions, but this will be made available to you all. That is my email if you have any questions, comments, concerns. And then the links are to a lot of the resources that I showed in the slide. So thank you all once again for your attention, and I will turn it back over to Ms. Joyce.
Thank you, Kenya. She's our favorite FDA person. She always comes through for DCO.
Thank you.
Next up, we have Chirag Bhatt. He will be speaking on social media and food safety.
Thank you so much, Kenya. We have Mr. Chirag Bhatt. After working with local regulatory agency in the city of Houston for over 26 years, Chirag worked as a customer software company with a customer software company as a VP Food Safety Client Consulting for a few years prior to joining a large restaurant company, Blooming Brands, as their global regulatory compliance manager. He also worked with a major distribution company, Cisco, as a regulatory and technical services director. He recently worked with a retail company, Boosie's, as the director of food safety and QA for 2 years. Currently, Chirag is the director of regulatory affairs, environmental health, with HS GovTech, a company providing SaaS, software as a solution, for over 800 environmental health department agencies in North America. Chirag holds a BS in biology and chemistry. He has been actively participating in the Conference for Food Protection since 1998 and has served in many roles. He is a registered sanitarian with the state of Texas and holds certified comprehensive food safety credential from NEHA. He has served as chair for the National Restaurant Association QA Executive Study Group for 3 years. Currently, Chirag serves as an Education Advisory Board member with Food Safety Summit and is an advisory council member with SANI Professionals. He lives in the great state of Texas. Please join me in welcoming Mr. Chirag Bhatt.
Good morning. Okay, so we're going to talk social media in the food safety, whether it's your friend or your foe or your enemy. How many of you really think that social media is here to help you? Raise your hand. How many of you think it's fake news? How many of you still are on social media? All of you should be. Because it's here. Whether we like it or we don't. Social media is here. How many of you heard about a story in the news in the last 10 days about a trending challenge on TikTok about cooking your chicken using NyQuil? Have you heard about it? FDA had to come back out and share an announcement, share a detail on their social media platform. So did CDC. So did the manufacturing of the drug, NyQuil, that this is not the purpose of NyQuil. You cannot cook food in NyQuil and expect to live after you consume that chicken. So it's dangerous. But social media is a platform that allows people to become what they call now influencer. To me, an influencer in my life has been my parents, my wife, my teachers, and everyone who has actually taught me who I am today. It's not someone on TikTok or Instagram who I can call an influencer. But that's how people know. That's how people think. And that's how people assume that everything and anything you see on the internet, especially on social media, must be true. So let's talk a little bit about how it impacts the food safety world. Here are some numbers. And I'm going to let you kind of digest a little bit on what these numbers represent. Look how many people are using social media. And as we know, we're talking about Twitter, Instagram, Facebook, TikTok, and of course YouTube, along with so many other things. There are bloggers, there are Reddits, there is Pinterest, there's WhatsApp, there's Telegram, and so many other platforms where people share things that they think must be shared. 3 billion monthly active users. Active users, if you just have a Facebook account and you're not touching it, which is something similar to what I do, these are just active users per month. 2 billion on YouTube, 1.5 use Google. Instagram, it's growing, 1 billion. TikTok has grown exponentially in the last year or two. Twitter doesn't have such a big number, however, it's fairly large. And then there's a professional network called LinkedIn. And if you're on LinkedIn, you see that some people who are not able to express what they want to express on Twitter and Facebook are now using LinkedIn as if it is Facebook or Twitter. I've seen many of them. It is a phenomenon that defines who we are today. Social media is here to stay. Internet access is everywhere you go. And this is a key statement. Social media is a love child of the World Wide Web. Because the web came, everything else became reality, and then now we have social media to worry about, to ascertain whether it's true or not. Blogs, forums, networks, photo sharing, social gaming, microblogs, chat, and social networks. These are the problem areas, or could be a helpful, friendly areas. 2022 global social media penetration rate reached 58%. That means 58% of the people in the global market are on some type of social media. And that number used to be only 45% just 2 years ago, 3 years ago. And then the pandemic happened. Everybody is on social media trying to find out whether this is a symptom of COVID or not. This is the right medicine for you to take over the counter if you have COVID positive test or not. The North America rate is even higher, 82%. In the European market, it is a little bit bigger than in the US or North America, 85%. That gives you an idea where who is. I don't want to break anything. Look at the numbers. The millennials. You got the baby boomers, you got the millennials, you got the Gen X, and you got the Gen Z and Gen Y, and real soon they're going to have Gen A and B and C and D, because sooner or later they're all going to be in the market trying to ascertain what is and what is not. Nearly 3/4 what is this? I'm having a hard time reading it. The 3/4 of the marketers believe social media is effective part of their business. Now, businesses do rely on social media. Don't misunderstand me. Businesses must rely on social media. And this is how they spread the word. This is how they spread the marketing effort. This is how they lure you to go eat at their place or to buy at their place. Where are we going? Video is one of the most important trends in the social media network, and I think all of you have seen a video or two on whether it's a Twitter, Instagram, Facebook. 82% of the internet traffic in 20 social media marketers will increasingly zero in on videos as part of their overall strategies to target. You have to have the right amount and the right type of videos that people use to target their audience. Now, whether you're trying to sell something or whether you're trying to promote something or educate people with, video is the best platform that the social media is using nowadays. And of course, it has to be a specific type of connection that you make with that audience in order for you to bring that customer or that client back to your business or your operation. While social media interactions are currently not fully understood as individual health behaviors and outcomes are shared online, social media offers an increasingly clear picture of the dynamics of these processes. So even though it's not fully understood and it's not fully clear, it's still the best platform. Common platform can be used for engaging the public and communicating your key public health messages. Advantage over the traditional public health surveillance. Your newsletters, your emails, your brochures, your handouts, when you go to the conference and you have an exhibition booth and you put a flyer on your table. If you take all of that and compare it with your social media technique, social media still wins. People just don't read things in a printed format anymore. They're just not used to it, especially the younger generation. And it goes true for the food safety message as well. Most of the time when you're in a food establishment or a business operation and you have multiple locations, when you are conducting your food safety training for your food handlers or whoever it is that you're targeting that food safety message across to, they still relate to it better if they see a video on Instagram or Twitter or your own network or your own portal as far as the internal network is concerned. It does provide a timely, relevant, and transparent information of public health. So here are some examples of who's out there as far as the regulatory agency is concerned on the social media platform, including your own health department here at DC Health. You're out there on social media and you're doing the best you can to promote and educate the people that you regulate and you represent at the same time. Content. Content has to be relevant. Content has to be specific. Content has to be a unique content so that you can not only bring people to your social media platform, but you also interact with them and you bring them back to your platform. Many times a regulatory agency rely on someone who is responsible to manage and monitor the activity on social media platform, whether it's Facebook page or a Twitter account or an Instagram account. Once you post something and someone provides a response to you or replies to your post, whether it's positive or negative, and believe me, it will be both. There are trolls out there on the social media network that have nothing to do with what you're trying to preach to them. However, they feel compelled enough to go back and troll and say something negative. So you as a social media or a marketing manager, you have a responsibility to make sure that if the information that is shared back to you from your user, from your audience, if it is false, that you have an obligation to make sure that you provide the correct information. If they're just trolling, then you can just simply ignore it. And if you're a social media manager, you probably have access to delete some derogatory, negative, or false accusation related comments. You can hide the comments because you don't want someone, when you're trying to send a message out that norovirus is the biggest culprit in a restaurant industry and it creates so many foodborne illness outbreak because of this, somebody don't need to come back and prove you wrong, especially if they are wrong. If they are correct and you accidentally posted something that is inaccurate, by all means, it's better to correct your mistake, apologize, and move on. Because this can happen. Many times when you type things on a little keyboard on your phone or your iPad, you're probably going to miss something. You may probably, instead of saying 64%, you may say 46%. It happens. It happens to all of us. But it is better for you as a manager to interact with your clients or your customers and make sure that you interact and provide the right or wrong information that may be shared on your platform. Test. Can everyone hear me? Oh, great. So here are some messages that you see on social media. And food safety messages are shareable. Food safety messages with some key graphic representation, as Kenya was showing you what FDA provides you in a poster format. And if you're going to use FDA's poster, make sure you give them credit that this poster is available for you to get from an FDA website. It's okay to share someone's content, but give them credit. And it could be a fun message. I mean, we can use some slang, we can use some trending hashtags, we can use some key component that people are attracted to. For example, here, Food Safety Friday, why not? And then you can take the person who is interacting with your social media platform to a link, to a website where more specific, pertinent information can be shared with your audience. So if you are really curious on what is the best time to share or post on a specific social media platform. So here it gives you some ideas on when to post and when not to post. So here, best time to post on Twitter. Worst time to post on Twitter, because many of them are asleep or resting, hopefully. What's the best time? Wednesday. And this is the one for Facebook. Instagram. As you can see the trend, it's different days. See, on Facebook you have a lot more days. On Twitter you have a little less amount of time. On Instagram there's Thursday. And then on LinkedIn, different time, 12 p.m. to 5 p.m. Where most everybody on a professional network has gotten their daily work done. After lunch, they're on LinkedIn trying to share, read, post, share, like, dislike, whatever the case may be. Online videos to talk to teens about sugary drink consumption. Some examples. Healthy pregnancy. Health departments around the nation are embracing social media as a new way to connect with public, and they offer health professionals the ability to deliver public health messages from common sense guidance to critical information during an emergency. For example, you have a boil water advisory, or you have a major foodborne illness outbreak in your jurisdiction that you're dealing with. or you have a salmonella, or you have a food safety recall. These are the platform, because believe me, before they read your broadcast email, or before they wait till that 6 o'clock local news story, they're going to be on social media platform, and this is where they're going to get that information much quicker than what you anticipate that they will be getting. Many times, the regulatory agencies will have a database of everyone's email account or a text messaging feature. So some of the software solutions that are out in the public, for the public health agencies, and this is a shameless plug for my company, but in my company, we provide a tool to a regulatory agency so that if you have something that is very critical and time sensitive, and you have to get that message across, you can literally go in and within a minute or two, type up your message according to the way you want to format it, and send an SMS text message out to each and every one of the operators. So within 5 minutes of something that you discovered, everyone in your jurisdiction is now notified. And then you can send in the detailed broadcast email if so needed. CDC has a social media and a digital tool library. They also have a lot of images that we can share, and they have widgets, metrics, and guides. And here's the website, cdc.gov/social media. Pretty easy to remember. Tweet regularly, reread, spell check, and double check, use images, interact with your followers, and check your stats. It tells you how many times this particular tweet that you sent out yesterday morning about something very important, how many people have actually read it. The administrator can also find out that how many of this interaction resulted in someone actually going to your profile. Because on your profile, you have your website and you have some other pertinent information where the person who is actually interacting with your post can identify and visit. Again, change your content, be social, use hashtags, because hashtag is what people search with. So when this TikTok thing happened with cooking your chicken, the hashtag was cook your chicken with NyQuil. Weird. Hopefully none of you tried it. Because if you did, you wouldn't be here. You'd probably be in a hospital. Start a trend. If you don't see something trending, create your own trend. Noro is here. Hand washing saves you from Noro. Using a hand sanitizer saves you from Noro. It's probably a kind of long hashtag, but hand washing. Noro outbreak. Be creative. Check your stats. Know your audience. Post regularly. Most of this platform even allow you to schedule it. So if you're typing something up at 10 a.m. in the morning and you want it to go out at 1:30 or 2 o'clock in the afternoon, you can set it up so that it goes out at the right time, as we saw earlier. Pay attention to the conversation around you. Use photos and link. Emojis. Nowadays, people communicate with emojis. The praying hand and the smiling face and the shaking my head emojis. Those emojis are popular. And people will interact with you simply using emojis. We've used it. Now, sometimes I'm communicating with my wife on a text messages and I don't have much time to type up a whole sentence. I'll just send one emoji and she'll get it. And she does the same thing in return. So it works. Don't go for likes and shares. That's not really important. You just want to make sure that you're getting your message across. Work to inspire public health action, not gain popularity. Now, if you're LeBron James or Michael Jordan, yeah, you're probably going to have a large followers. Or if you're Beyonce, or whoever it is, you're going to have a large follower. And you want to hope and wish that one day they somehow see your post and they retweet or reshare or whatever that case is. You'll be amazed to find out how many more new followers you'll gain because LeBron James just posted something that you shared. That's the influencer. Work to inspire public health action, not being popular, because it's not about being popularity. And of course, hashtag. Here are some of the agencies that are probably near and dear to the food safety professionals. So I just wanted to share a list of some key social media accounts. This is Twitter. At USDA, FDA, Food Insight, USDA ARS, Food Safety News, Center for Food Safety Magazine, Nature, CDC. And if you just go to Twitter or whatever the social media is and search for some of the keywords like Department of Ag, or Extension Services, or Department of Health, or the name of the county, city, state Department of Health, you will find all their social media accounts. Because you know, if you can't find something, go on the internet, you'll find it. Probably some time left, so if you have any question, I'll be more than happy to entertain your question. If not, yes, somebody?
Hi.
Hi.
I'm from the Prince George's County Department of Health. What do you see as the best course of action when a facility is gaining traction on social media from violations or perceived violations?
That's a very good question. So, when I worked with the government agency many years ago, I was with the City of Houston Department of Health, where over 13,000 food facilities were regulated. And I left the government position in 2007. So at that time, the social media was not so prevalent or so active or so dominating factor in our communication method. So we didn't really have a lot of interaction at that time. However, many times a local facility are exposed, if you will, by a media representative. They come to your facility and obtain the reports and they say, this place had this problem, this one had this one had this, and these had 4 stars or 5 stars. So there's positive and negative. And people will react to it. People will ask questions. So as long as you as a public health agency are being accurate and truthful and not exaggerating anything, just show them the facts. That on September 15th, this restaurant had this 7 critical violations. That fact doesn't go away, it's there. Now whether the restaurant operator or the business operator challenges you as a public health agency, you can always fall back on the public information side. That you're sharing what is allowed for you to share to the general population as far as the public health information is concerned. You can't go above and beyond and start giving your editorial comments. That, yeah, we told them about this violation in January of this year and September of last year, so they just don't listen, they're just bad operators, so don't do that. Give them the fact that on September 15th, these are the items. And these are the items that FDA tells us are the contributing factor to causing a foodborne illness. Be truthful, be honest, be transparent. That help? Okay. I can hear, I can hear. Okay. So maybe come up to the mic and we can definitely have more discussions. There's one.
Oh, okay. Got it.
Okay, my initial question was, what is the best course of action when you see that a facility has gained traction because of perceived food safety violations? So that was my initial question. I guess my follow-up question would be, at what point do you interact with the issue? So I can give you an example.
Okay.
I had a facility that, again, gained traction on Instagram because of pictures taken by an employee. Now, a lot of these violations weren't technically violations, they just look really bad. But at what point do we as an organization, or does the organization respond to that sort of thing?
You know, you're going to have disgruntled employees expose the place of business because they get fired or terminated or whatever the case may be. So yeah, they're probably going to have some traction as far as having been able to take a picture of a rat in their storage room. That a sanitarian, when he or she visits, you're probably not going to see it. So it's a snapshot. And if someone was to come to you as a public health agency, when they see something trending on social media, you're basically just going to say that during the time of our investigation, we did not see a live rat. However, we can't really claim what the inside employee was able to see or hear as far as the violations are concerned. So we cannot attest or deny what they have posted. Just straightforward. Because I always learned that it's better to come out with one truth instead of one lie. Because if you have one lie, you're probably going to need 50 more to cover it up. So just be truthful, be open, be transparent. That doesn't mean you have to give your policies and procedures manual for them to read, but just give a professional feedback and hopefully they'll go away. Hopefully they won't.
Thank you.
Sure. Anyone else? Thank you all very much. Appreciate it.
I want to thank Mr. Sherrod for coming all the way from Texas with that great information. So next, we're just going to take like a quick 10-minute break, and we're going to bring on Dr. Eno Mangla to talk about monkeypox.
I'm just gonna leave it on the button right there, but I'll be close to the button.
Okay, thank you.
The state, city, and county levels, including assistant director at the San Antonio Metro Health Department, director of infectious disease and immunizations, and acting state epidemiologist at the Georgia Department of Health, lead epidemiologist at the Indiana State Department of Health, a supervisory epidemiologist at the Texas Department of State Health Services, and laboratory manager at MedTox Laboratories. Dr. Mangla completed his undergraduate degree at the University of KwaZulu-Natal, I hope I'm pronouncing that correctly, at a master's at the University of El Paso, and his PhD at Texas Tech University. After that, he completed his infectious disease fellowship and an MPH at the University of Minnesota. After his fellowship, Dr. Mangler served as the chair of infectious diseases for the United Nations Associations and traveled to South Africa, Swaziland, and Lesotho as part of the response to HIV, TB, and malaria. He interned with Congresswoman Betty McCollum and served as a public health advisor for Colette Von Hanna. He was board chair for the Texas Kidney Foundation and one of the 17 gubernatorial appointees by Texas Governor Abbott to the Chronic Kidney Disease Task Force for his expertise in diabetes-related amputations and kidney failure. He served as an associate professor and director of public health at UIW School of Medicine and as an adjunct professor at the Mercer School of Medicine and the University of Georgia. He serves as the chief scientific officer for Toxic Screen Laboratories, TOXY, Screen Laboratories. Dr. Mangler has received numerous accolades for his leadership in public health policy development, social determinants of health, and social justice. A strong patriot of human rights, he is one of the victims that have survived the apartheid era and the Free Nation Nelson Mandela campaign. His African roots ignite his passion for identifying pathways for immigrants and minorities to overcome health and higher education barriers. Please assist me in welcoming Dr. Anil Mangler.
Thank you for that introduction. Okay, thank you, everybody. Good morning, I guess. And so what I'm going to talk about today is on the monkeypox outbreak, what it is, what we're doing, how we're doing, and kind of really good information to share so you understand risk, you understand transmission, and most of all, how we're actually trying to get this under control. So I'm going to be walking around so I can actually also see the screen. So next slide. Next slide. Next slide. Thank you. So if you look at this, in anything that we do, the so-called social determinants of health are very important. And in this outbreak that occurred in DC, we really focused on also the social determinants of health. So number one, we kind of looked at healthcare. We looked at the physical environment where people, reside. And then of course we looked at actually education. So again, when you look at those three goals, I think that is where we really focused effort as the progression of these outbreak occurred here in DC. So if you look at it, there's just a few items I'm going to cover, and it's just some background, some statistics, some clinical recognition, and then of course some treatment, and then behavior change. So if you look at the whole issue of monkeypox, it is a rare disease. But we have seen it in the US once or twice. It's very common in certain parts of Africa where it's endemic, but it's very new to other countries where it has not been endemic, like the pandemic or the outbreak that's occurring at the moment. The normal transmission mode was animal to human, and we did not see much human to human other than this outbreak that has occurred in non-endemic countries. So really important is what we call the taxonomy tree, right? So this falls under what's known as pox virus, and the pox virus falls under what's known as a genus called orthopox virus. The orthopox virus contains numerous different viruses, including smallpox. You have, the camelpox, and then of course we have this monkeypox. Why I have this slide is it's really important to understand that all these orthopox viruses are very similar. It's a DNA virus, and they all have almost a 93% similarity in their DNA. Why that is important? Because if you know, in our stockpile, we have vaccines for smallpox. We also have treatment for smallpox in the case of an emergency, right? So it was good that we know the genetic makeup of 93%, so when we saw the outbreak coming into the US, we could utilize the smallpox vaccine as well as smallpox treatment to really get ahead of the game to make sure we can control the monkeypox outbreak. Now, if you look at signs and symptoms, it normally starts with a new rash, which is almost like a macular rash, and then it goes into different phases, right? Papular, vascular, pustular, and so forth. The other symptoms you normally would see is kind of fever, and these rashes actually start on your face and then goes down to the abdomen, hands, feet, and all around the body. Other symptoms, again, is very similar to flu, right? Your headache, feeling malaise, chills. But one important thing that you don't see in like a flu or say COVID is normally this lymph nodes. You start seeing lymph nodes in your neck and many other areas of the body, which is very typical of something is diagnosed as the monkeypox. If you look at the rashes, as you can see, they go through these different stages, right? So it will start with a kind of macular, simple like a rash, quote-unquote. Many even mistaken like a poison ivy rash for monkeypox. That's why if you see any new rash, you want to have your physician check it just in case, but then you also want to make sure that, there's epidemic. And I say that because we need to remember monkeypox is a virus, right? Anybody could be infected. It all depends on your risk and how high your risk is and risk activities. So, when you look at cases, it normally starts with a suspect case, and as you can see, a suspect case is any type of new characteristic rash, right? Plus some type of epidemiology link, like if you were with somebody that had monkeypox, or like if you were part of going to a country where this is endemic and so on. And then a probable case is when a physician tests these lesions or these blisters, it's sent to the lab, and it's called, if the lab is positive, it's known as an orthopox virus positive. Earlier in this outbreak, we normally had that then go to CDC for confirmation. We still do that, but not all samples are sent to CDC. As we see a probable, we normally take that as monkeypox, and we start doing what's called an assessment. We get people on treatment, we do contact tracing, and we get the close contacts, vaccinated as soon as possible. So, what's the transmission routes, right? Very important. Because if you understand transmission, you know how to prevent it. So number one is direct contact with somebody's scabs, or you can say rashes, and then some of the body fluid. It could also be by respiratory secretions, when you're in very close contact, skin-to-skin contact, like kissing and hugging, for prolonged amount of time, right? Or then, of course, intimate physical contact, such as kissing, hugging, cuddling, and sex. The other important thing here is touching items where there may be some of the bodily fluids, or even the fluids from these so-called lesions, right, that may be infectious. So again, that may be possible. Pregnant women transferring this from fetus, right, it could go to the child. So that's again a very important way to look at this, to the fetus from the placenta. And then of course in these endemic areas, the main route of transmission was that animal to human. When someone gets monkeypox, the incubation period is anywhere from, you could say, 5 days to 21 days. Normally people are starting to see rashes within 5 to 6 days. Once a rash starts, that's when someone is infectious, and the infectiousness or you're contagious till your scab falls off and new skin develops, right? Very important, because if you know for COVID, your isolation was Okay, 10 days or 14 days, whatever it was, depending on when in the pandemic you look at it. But with this, there's no timeline. The timeline is when that new skin develops and the scab falls off, that would be end of your isolation. So we have few things in our toolbox that really has helped with this outbreak. Number one is we have the vaccines. There's two different types of vaccines. And of course, then we have the antiviral, which is called the decavalent, or in short, TPOXX. So the vaccine we use is a Jenius vaccine. It's a 2-dose vaccine separated by 28 days. And the important thing is initially we were giving this vaccine subcutaneous. Now we're actually giving it intradermal, and it's gonna, still very, very effective. TPOXX really well tolerated in people that have been positive, are infectious, and it helps for pain management. And it actually even slows down the progression of lesions and shortens the time of isolation. I'm not going to go into detail with this, but this kind of shows you when you get your first dose of your vaccine, you already start building a large amount of protective immunity. And then when you get your second dose after 28 days, you get a relatively good immunity, and that is very protective for individuals that have close contacts. Let's look at numbers. So when you're looking at numbers in the US, we have about 25,000 cases now. When you're looking at globally, there's about 66,000 cases. When you're looking at our district, right, this was effective close of business last night. We have 495 cases. Out of those, we have 878 close contacts, and then we have 679 of those close contacts are DC residents. Here's the good news. The good news is we have now given out 35,000 doses of vaccine already, right? This 35,000 doses of vaccine is within 4.5 months. That is just, really important to know, because with that vaccine, we know it causes protective immunity, and that protective immunity really has made an impact here in Washington, D.C. So how do we measure impact? So in epidemiology, what we do is we use something known as an epicurve. And this shows you the epicurve from the beginning of the case 1 here in D.C. And as you saw from case 1, it went up and up and up and up, right? So now we had that 495 cases. But as you can see, there was kind of a tapering. We also had a peak. The important thing here is this is day by day, right? Now, if you look at the same data by week, you will really see the impact we have had in DC. We actually lead the nation in the number of cases we have decreased since our peak. So if you look at this, we peaked right there in July, week of July 17th, right, as you can see. After that, our cases have been decreasing by 21% per week every week, right? So there's a 21, and that's an average, right? So the good news is we're getting to a place where we want to be, but again, we still are going to be very, very aggressive, because we want to try to actually stop this outbreak here in DC. If you look at another slide that we use to kind of align ourselves with what is going on in the district, it's called doubling time. As that doubling time increases, it means case rate is decreasing. That means the cases are not doubling as fast as they were early in the pandemic. So for example, that 6.1 means early in that outbreak time, our cases were doubling every 6 days. Now, it's every 6.5 days, 12.6 days. So that kind of helps show that the progression is slowing down. This is also an average, kind of rolling average, showing that, we peaked around there, around the July 17th time, and our numbers have now started significantly decreasing. This is the demographics, really important, right? Because what we want to see is who's affected, how we can help those communities, where are the hotspots, and really focus effort in those areas. So in DC, our data, very similar to the national data, is when you look at our cases, 495 cases, majority are male, 50% is almost gay. When you're looking at age group, the age group that is really affected is the ages 25 to 39. So we already have an idea where the focus is, right? With the race, you can see whites and African Americans very close, about 42, 43%, ethnicity 20%, Hispanicality. Many have already been tested, so about nationally 40% are HIV positive. Here in DC, about 38% are HIV positive. So having said that, we also now look at how many people have got vaccinated. So as you can see, out of the many people that have been vaccinated, many are the male, many are gay, and then this is a disparity we see. 62% of individuals vaccinated were white, 21% were African American. So the importance is, data is very important, right? Because when we see this disparity, we need to do something. So we did do that, and what we did is, this is another slide kind of clearly showing this data. So as you can see, the disparity here, whites and African Americans have similar cases, right? But look at the vaccination rate, almost 3 times different. So what we did is, when we were doing these vaccination clinics, you had to register and you had to get your vaccinations. So you can see these are cases very similar when it comes to white and African American. Vaccination is very different, distinct. So we decided as a Department of Health, where we, as a team effort, we all got together and said, how can we kind of, narrow this gap? So instead of pre-registration, we had these walk-up clinics or pop-up clinics. You walk in, you give your list, you get vaccinated. Look how high that number shot from African Americans, 21% getting vaccinated when we started doing these walk-ups. That number doubled, right? Excellent. So we had now, using data-driven facts to see how we can close these gaps. This was really important because this kind of shows, right? Remember I showed you the earlier slide, that this is a 3-fold difference. Now if you look at this slide, this is by race, how our cases were. So if you look at the pink that are whites, cases started increasing earlier, and then it plateaued, and then there was that 1/3 a significant drop, and then kind of started dropping. Look at the African American population. It started going up, right, the blue, and then it started going down, but there was no drop, right? That's because the vaccination rates were 1/3 less. So now if we get the vaccination rates up, we will see that significant drop as well. Again, this is, a slide that shows the hard work that every team in DC Health played a part, but also within DC government, right? So this is partnerships that were hospitals. This is partnerships that were providers. Partnerships with everybody else that participated in making sure that we want to control this outbreak. So this tells you all the major states and cities, the percentage of the population that got vaccinated. Look where we are compared to the rest. But when you break it down by per 100,000 population, we have given almost 5,000 per 100,000 population, compared to the closest was New York City, which is actually 4 times less than us. But when you look at our high-risk population, we've already given 50% of vaccinations to that population. So you wonder, right? Is this real? Yeah. Part of it is the vaccinations that we have put into people's arms that has made a significant difference. So, having said that, this is where our clinics are, right? We try to kind of broaden this, so we're making sure that there's access. Again, part of the social determinants of health. These are where more of the, providers are becoming in where they can provide vaccines. We're working with universities, we're working with the DOC and many other facilities to ensure that vaccines are available, and if someone is at risk, they can get vaccinated. Right? These are again areas within DC where treatment would be available. But it was not just vaccines that are effective, right? The other important thing that was very important is behavior change. So you saw the early slide I had on social determinants of health, behavior was one of the factors. So CDC collaborated with the DC Department of Health, and we did a survey, a robust survey, to see what some of the survey results show. So 48% of individuals reduced the number of sex partners. And that's important because you're decreasing the risk factor, that means you're going to decrease the number of cases. 50% reduced one-time sexual encounters, and then 49% reduced having met sexual partners with apps and going to these different sex methods, right? So having changed behavior and the robust vaccinations campaigns we've had in DC, our numbers, like I said, has decreased by 21% per week every week since the peak. But in the past month, it's also decreased almost 75% from where it was a month ago. So significant difference, right? So on that, what I do want to kind of say is really important is when you look at smallpox and monkeypox, right? Remember the first slide, they're in the same so-called genus. So why is this eradicated and this not? The key reason is this is human to human to human. This is human to human, but also rodent to human, primates to human, and then small mammals to human, right? So you can't kind of shut all these pathways. And so that was kind of a very difficult task, and that's why it's endemic in those countries. So this is really important in epidemiology. When you want to end the outbreak, there's three important things you need to do, which is exactly what we did. We have an agent, you have the host. Agent is the virus, the host is us, and the environment is where we live, right? So if you could block these three, you actually can end an outbreak. So, number one, could we block this? Yes, we have vaccines and treatment. Number two, could we block this? Yes, avoid crowds, social distancing, and the most important thing that we know is it's skin-to-skin contact. If you can avoid skin-to-skin contact with knowing someone that may have it, you're not going to get infected. And then number three is agent to environment, right? Do whatever we were doing from COVID. Wash your hands, cleanliness, sanitize, that's it. So on that note, we had a visit from the White House, and this is actually kudos to the entire health department with every department working cohesively together. But not just that, right? It was the DC Hospital Association, it was the providers, it was all the other government agencies all work together. And we kind of have now really made an impact to the rest of the country of what we have done and accomplished here in DC. So we had the White House visit, we had the Secretary of HHS, Secretary Xavier Pereira visit, and kind of really acknowledge the work that DC has done. So on that, I'm going to stop. I know this was a lot, there was lots of information, and at least it gives you an idea of where we are, or where we started, where we are, and we will continue to be aggressive in making sure that we stop the outbreak in DC. So thank you, guys.
Does anyone have any questions for Dr. Mangala?
Yes.
Transmission for the virus from person to person is contact, but also how about the home-like person, like secondary surface? Does that transmit also?
Right. So we are working on that. So we have not identified, there is no data to show yet formite transmission. CDC is actually working with our cases. So what we have, let me share what we have already done. So out of all the cases we've had, many of our positive cases actually consented that we do two things. Test their pets, right? That was important. And then environmental testing in DC for anybody that were, positive cases. We have not identified any secondary transmission from formites, number one, and none of the pets that tested positive that were living with individuals that were positive, none of those pets are positive. So that's a really good sign because you don't want this to transfer or transmit into pets or that type of population because of the scale of impact, it becoming endemic, right? So on that note, what we have seen is 99% has been that skin-to-skin contact, and we still gathering a lot of data to kind of confirm that, is there other modes of transmission, and we have not seen that yet. Other questions? Yes.
There was a discussion at WHO level that changing the name of this disease. How's that progress?
Yeah, so the question is changing the name. They've already changed the clades names, right? So there were two clades, right? The one was known as the Congo Basin clade. The one was known as the West African clade. They have now made the Congo Basin clade known as clade 1 and the West African clade known as clade 2. They're working on the bigger name, and those changes will be coming up shortly. Other questions?
Question?
Yes.
Yes, Doctor, thank you. My question is, can the monkeypox vaccine mitigate the immunologic potency of the COVID vaccine?
I couldn't hear that. What? Can you repeat that?
I said, my question is, can the monkeypox vaccine mitigate the potency of the COVID vaccines or any other vaccines or vice versa?
Yeah, so the question is about the COVID vaccine, monkeypox vaccine. So let me kind of, and that's a very important question because I think a lot of questions I get is about the COVID vaccine, its effectiveness, and then multiple shots and a booster. Fair enough. Now we have a monkeypox vaccine. It's actually the smallpox vaccine, right? Used for monkeypox. Here's the difference. So I want to be very clear. If there is any misinformation, we can stop it today, right? The COVID virus is a RNA virus. It's a single-stranded RNA virus. For that virus to mutate is pretty easy. That's why we have seen different types of variants, right? Like alpha and delta and gamma, and then we had Omicron and BA4 and BA5 and you name it. In addition to that, because of those changes, right, we've had our vaccine, and then we had to get fully vaccinated or up to date, and then boosters. with the monkeypox, this vaccine we have is 85% or more effective. That's number one. Number two is the monkeypox virus is it's a DNA double-stranded virus, which means it's much more stable molecularly. Number two is it's rare for it to really mutate, right? So if you look at that, it's not going to change molecularly as fast as what COVID did. And on this side, you have a vaccine that's 85% or higher effectiveness. Putting those together, that's why you see vaccine effectiveness has been excellent, because the vaccine has worked. As for people saying, well, we need another dose or anything, that's highly unlikely. We're not even going there. We think we could stop this, and it's just being very aggressive and not stopping. So that's the difference between the COVID vaccine and the monkeypox vaccine, which is the smallpox vaccine, which is very, very effective compared to where we were with COVID. Again, with COVID, we had to get this vaccine discovered in UN trials. With the monkeypox vaccine, we've had something already in the stockpile, and we started using it, so we were very proactive in this outbreak when monkeypox showed up in the US. Other questions? Okay, thank you, folks.
Thank you so much, Dr. Mangler, for that awesome presentation. Now we come to the most exciting part of our program, where all of our speakers, of course, are excellent, and we've obtained some phenomenal information. But now is the time to honor the people who actually cook and serve the food here in the District of Columbia. And the recipients of the Director's Award are receiving this award because they have obviously done a phenomenal job in keeping people safe, and the health department wants to recognize them. When your name is called, please come up and receive your award. We're excited and happy that you are receiving this award today, and we're sure that you are as well. So our director is here to present the awards, Dr. Lewis. Dr. Sharon Lewis is the interim director for DC Health, formerly the senior deputy director of the Health Regulation and Licensing Administration, known as HRLA. Dr. Lewis is responsible for fostering quality care for those who receive healthcare services in the District of Columbia that come under her purview. At DC Health, she has overseen 19 professional boards, 72 health professions, food safety for more than 6,500 establishments, rodent and vector control, animal services, pharmaceutical control, radiation protection, healthcare facilities, clinical laboratories, intermediate care facilities, criminal background check for healthcare professionals, compliance, investigation, and surveys for the licensing and certification of facilities. That's a lot. Dr. Lewis has more than 30 years of government service. She is a registered nurse and has a doctorate in healthcare administration. Dr. Lewis is a certified public manager and has completed Harvard University's John F. Kennedy's School of Government executive program on strategic management of regulatory and enforcement agencies. In addition, while at DC Health, she was a clinical investigator for an infusion pump study for the Food and Drug Administration and the Agency for Healthcare Research and the Quality Patient Safety Improvement Corporation. Whew. This lady has done some things, but we'd like to, if you would join me in welcoming our director, Dr. Lewis. Thank you.
Thank you for that. And good morning. I am just so thrilled to be here. At DC Health's 11th Annual Food Safety and Defense Conference. It's an exciting time to be together since we are now in person since 2019. Some of you may remember Washington, D.C. has been known as one of the most exciting foodie cities in America. I must commend the food industry over the last 2 years on pivoting your business models to adapt to a changing customer base, enhancing menus, expansion of takeout and delivery foods, developing apps, and expanding outdoor cafes with a new dining experience. So thank you for being innovative during this time. DC Health regulates more than 6,000 food establishments here in the city. Our sanitarians are always willing to go the extra mile to enhance that all of the district's food safety needs are met, not only for special events, but also for those unplanned pre-operational inspections as well. I would like to take this opportunity to thank the DC Health team in the Health Regulation and Licensing Administration Food Division for their dedication and putting this conference together year after year. Planning a conference takes months of hard work, and collectively, members of the Food Protection Task Force work tirelessly in developing an interesting agenda and securing quality speakers, as well as you being included, the food industry that is, to partake in a fulfilling day. Now, Joyce Moore, our principal investigator, and members of the Food Task Force and others that participated in the conference planning, I'd like for you to just raise your hand or either stand up, because I want you to be recognized for the hard work that you've done. And thank you very much. Thank you. And then I must also recognize the food sanitation inspectors and those that review the plans, those that conduct food inspections, day, evening, night, including the weekends, as well as the correctional facilities. Can you raise your hand or stand so that I can also recognize you? Thank you. Thank you very much. Thank you. Next, I would like to show our appreciation for the business owners and the operators as we continue to navigate what food safety looks like in this new normal. As we continue our partnerships to strive towards compliance, we know that you all work very hard to keep residents safe and to keep the district as the top food city in the United States. Today's award recognizes establishments that have excelled in food safety for the last year, and since 2018, we have given out over 100 Directors Awards. So with that, I am excited to acknowledge the winners of this year's 2022 Directors Award for Certification of Merit. So thank you. So now we're ready to issue out those certificates. So thank you so much. Megan?
So our first recipient is 1790 Coffee. Are they here? Bluestone Lane. Bowers Fancy Dairy Product. You can come on down. He's coming around right now. There he is.
Thank you. I would like to give you the Directors Award, Food Safety Merit Award of Excellence. Thank you very much for your hard work.
Well,
thank you.
Are we going to get this on? Chef Majid. Chipotle Mexican Grill, located at 625 Monroe Street, Northeast. Chopsmith. The Dew Drop In. Dolcezza Gelato. Ebenezer Coffee House. The Elsie Whitlow Stokes Elementary School. Is it, sorry if I'm pronouncing this wrong. Is it Inet? Is that Injera? Ishet, thank you. Is Injera present? Food and Friends? Have Some Charisma? Indigo, Indian Food on the Go. McDonald's, located at 775 New York Avenue, Northeast. Mess Hall. Panera Bread, located at 601 13th Street Northwest. Another Panera Bread from 106 Irving Street Northwest. Oh, got quite a few. Panera Bread, located at 4501 Wisconsin Avenue Northwest. Okay, Phoenix Park Hotel. Okay, Potbelly Sandwich Works. Smoothie King. Supergirl. South Block. Starbucks at 401 8th Street, Southeast. Another Starbucks located at 900 23rd Street, Northwest. Starbucks located at 3416 Wisconsin Avenue, Northwest. The Spice Suite. Tian Tian Food Market. Union Kitchen. Wawa Market. And lastly, the Washington Marriott, the main kitchen of the hotel. Congratulations to all of our recipients.
Thank you very much. And I also want to recognize that we have just under 100 people that are watching us. So Those of you that are virtual, thank you very much for your hard work throughout the year, as well as, of course, those of you that are here. Look forward to seeing you all next year. So thank you so much. Take care. Bye-bye.
I just wanted to thank all of the awardees, the ones that are live streaming virtually. You guys have done a great job. Some of our inspectors I know are really hard, but y'all surpassed them and did a great job this year. Hopefully we can have more awardees next year. Just keep focusing on food safety aspect. As part of the food safety task force, we do outreach. If anybody wants our team to come out, give presentations, show you how to pass your inspections and do whatever that you think you might need help with, just let us know. We have a website. You can reach me at joyce.moore@dc.gov with any questions. If your inspector comes through, you can get the information through that inspector as well. Thank you.
Congratulations to all the recipients. That's wonderful, absolutely wonderful. Okay, our next presenter is going to be Steve Mondernock. Steve Mondernock is the Executive Director of the Association of Food and Drug Officials, AFDO. Prior to becoming Executive Director in 2018, Mondernock was the Bureau Chief for Food and Consumer Safety at the Iowa Department of Inspection and Appeals. Mondernock is a past president of AFDO. He served as the chair and co-chair for the Manufactured Food Regulatory Program Alliance, MFRPA. He is past president of the Mid-Continental Association of Food and Drug Officials, MCAFDO. Mondernock has co-authored several articles related to food safety in trade and peer review publications. Mondernock has a JD from Drake University Law School. He has completed graduate work in food safety at the Michigan State University. Please join me in welcoming Mr. Steve Mondernock.
Well, good afternoon, almost, I guess. I know I'm the thing preventing, or that's right between you and lunch. So we're just doing one technical thing here for just a second, but today we're going to take a little bit of a journey through food safety and talk a little bit about a handful of things that dramatically impact your all's ability to produce safe food. But before we do that, I want to go ahead and thank Andrea and Joyce for the invitation to be here today. I see I have a presentation. That's a good sign. I have a clicker. Now we are ready to go. So the first thing I want to talk a little bit about is food safety culture. So food safety culture is kind of amorphous, right? You probably are like, how do we measure that? How do we regulate food safety culture? And how do we measure that in our establishment? I'm going to just start by telling you a little story. So, and I'm going to use one that you probably all can recognize a little bit. So I have walked into lots of different establishments, whether they be restaurants, grocery stores, or manufacturers, and I think we could get a pretty good idea of what the culture is like in that organization in a matter of minutes. When you have a owner, operator, manager that's very proud of their operation, that knows their team well, that is interested in sharing what they're doing and proud of the work they're doing, those are often really good signs. I can think of a large distribution facility that had hundreds of employees, and the CEO that had a company at that point with 125 different stores walked me around and introduced me to every single person and could tell me how long they'd been with the company, what their history was with the company, and that sort of thing. That gave me an idea of the values that company had, how important that value and belief was. So some of those traits that we have, first is, do you have clear job responsibilities that have clear food safety expectations for your team members? Does everyone on your team know what their role is in food safety and why? Kind of a beginning point. The next thing you might want to think about is, are all of you as company leaders talking about the importance of commitment to food safety? I'll give you one example, and I won't tell you who it is, but for a period of time, one of our large national chains would say that we're not a food company, we're a logistics company. Well, what do you suppose message that sent to the frontline folks that were working in that brand every day? You know, food isn't what we do, so food safety clearly isn't a priority. We deliver stuff, essentially, or we get stuff to places. That just sets the commitment of what you do. The next thing we would hope is that your company leaders are walking the walk. So as leaders in your establishments, do you all start, when you walk in the kitchen, what's the first thing you do? Oh, come on, you know this. Wash your hands, I'm seeing it out there, right? You set the model, right? You need to remind and reinforce how important that hand washing is every time. Not to mention many other practices, but that's just one great example of setting the walk and expecting it. I can't tell you how many times I would walk in with the owner or operator and they would never think of washing their hands. Even though they were with a health inspector, that was not ever coming to their mind that they were going to do that anytime soon. So once again, it sets the expectation of your staff that if you do that every time you walk into the kitchen, that gives an expectation for them that this is important and we're setting that sort of culture. The next thing I talk about is, are you doing food safety trainings and communications designed to reach all your employees? So are they accessible to your employees? Are they in the right language? Are they of the right level so that your employees can understand them? Are we following those up with key questions and discussions to make sure, and maybe even practicing doing what we're talking about in the training? All of those are things that are signs of a good food safety culture. And then also we would want to say, is there an established way for folks to raise food safety concerns? Are the employees aware of those concerns? You know, think a little bit about that. Do they have an opportunity? Do you have an open atmosphere where an employee can bring a suggestion and say, hey, this process doesn't seem to be working for me. Is there some way that we could do this differently that might be more effective? So next, I'm going to show you something that might be familiar to all of you. Every time I walk into a restaurant kitchen, there is some sort of board like this that shows the goals for the establishment. And it often has things like service time, customer satisfaction scores, customer complaints, audits. Particularly if you're a brand, you're going to see those sort of things. If you're an individual place, it might be more revenue-based, number of orders, number of patrons, and those sorts of things. But there is some board like that in most establishments when you walk into a kitchen that's measuring certain metrics. What I seldom see on the board is any sort of metrics that relates to food safety, though it's probably, or it should be, your number one goal is to produce safe food, right? No one wants to get anyone sick. That is a bad outcome. So what are the things that would challenge you to think about? Are there ways that you can start adding something that's food safety related to that board? So think about that. It might not even be the board. It might be as simple as recognizing team members as they're doing something. You see a team member that's taking a temperature at an appropriate time. Great job. Hey, I saw how you used how you avoided bare hand contact in this situation. Good job of doing that. You washed your hands. Thank you for doing that and keeping our staff and patrons safe. Think about that. If you do just those simple things, and I know you're all very busy in your operations, but simple things make a difference. If you show that you value the team member and that you appreciate what they're doing, it really does help to emphasize those very important actions. So one of the things I'm going to encourage you all to think about as you go back home later today is, are we measuring the right things? Are we reinforcing those things? And are we being leaders in our establishment that are really establishing a food safety culture? And there are two types of food safety culture. Let me just make that clear. There are good food safety cultures and there are bad food safety cultures. You want to be establishing a good culture because it does go throughout the organization, and you'll see your performance goes up accordingly also in all areas. So as I move into the next piece, I'm going to talk a little bit about some folks that I call food safety heroes. And I have two of them that I would spend some time on today and talk a little bit about. And one of my things that I would love to see, and I know there are some food safety heroes out here in the audience today, is how you are being a hero in your operation. The two folks I'm going to talk about are fascinating individuals. One of them is contemporary, one of them is historic. The first one I'm going to talk about is Dr. Harvey Wiley. So Dr. Wiley really gets into the food safety scene about 1870. Really the father of all things food safety. He begins to realize that contamination of foods is a bad thing and is causing bad human impacts, and starts really beginning to take that to action. He managed to do something we could never get approved today, get a group of folks to start eating various foods with various additives that he thought probably would make them ill, and guess what they did? But he did this for years downtown at the Department of Agriculture building, and learned a great deal about what additives we were adding to our food really weren't safe. He continued his work over his whole lifetime, eventually leaving USDA, but before he left, he managed to get the first federal food safety law passed with the Food, Drug, and Cosmetics Act, at that point, the Pure Food Act, and going forward. But more importantly, he didn't stop when he left USDA. He went on to do other things that were very significant in the food safety world and in the safety world. He went from USDA to go to Better Homes and Gardens and establishing their seal of approval. So really looking for how can we do those things that protect consumers. Over that lifetime of career, really being one of the early consumer advocates, he made tremendous progress and really helped build what is our modern day food safety system. And I'll tell you, he was criticized every day. He was one of the most known names in the country. If you read the newspapers, the Washington Post, the New York Times, you would regularly see his name and everyone knew him. Theodore Roosevelt eventually hated him. Every Secretary of Agriculture he worked for ended up hating him because he was just a strong advocate. So I'm not going to say let everyone hate you, but definitely don't be afraid to do the right thing. The second person I'm going to talk about is a contemporary of mine. So this person comes from a small health department, relatively small, the state of Rhode Island, and he recently retired. But Ernie Julian is an interesting character, and for those that would know him, they would say character is the right term. He'd probably agree with me. But Ernie had a singular focus over his 30-plus year public health career, and that was to prevent foodborne illness. Nothing angers Ernie more than when you end up with someone sick, and particularly when you end up with a sick child. That is just his worst, as he would call it, it's a systems failure if there's a kid getting sick from the food we're serving. We've done something wrong. So he really was very, very passionate about about food safety overall and preventing foodborne illness. But the other thing that he really does well is he always has a consistent message. So when you talk to Ernie, he's going to say a pretty simple message. You know, if you do the right thing for the people that you're serving, you're probably going to do the right thing for food safety. Kind of interesting. Other thing that he'll tell you is, you know, if we look at patterns, we're probably going to figure out where the problem is. So he'll, you know, over the course of his career, he managed to solve what were ongoing multi-year outbreaks across multiple operations. He managed to actually make significant impact in a region not very far from here. Some of you might know where the Delmarva Peninsula is. A lot of fresh produce is grown there, and a lot of poultry is grown there. Of course, when you have fresh produce and poultry in the same world, there's a great potential for contamination, particularly for salmonella contamination, and that's exactly what we saw in that region. Ernie really led the effort to figure out why is this happening and how do we stop it over many years. So you think back about 7 years ago, we would frequently hear about a summer outbreak, particularly of tomatoes and sometimes other produce related to the Delmarva region. I'll just kind of show you where that's at. So for those of you that don't know, it's kind of that little thing that pokes out into the Chesapeake, between the Chesapeake and the Atlantic. So as you can see, it covers 3 states, Delaware, Maryland, and Virginia. But it's a fascinating issue that he worked on. But he did this constantly over a period of time. And I'll tell you, did he anger people by bringing up this issue over and over again? Yeah, he did. I'll tell you, the 3 secretaries of agriculture from those 3 states, he was probably on their dartboard, as you might imagine. But he went back and said, we have to do what's right for the people. And if we don't do that, we're not doing our job and we're not helping anyone here, including the farmers that are producing in the Delmarva region. And we'll say, and I probably shouldn't do this, but I do have wood here, we could knock on wood, those outbreaks are no longer happening today. And I would argue probably in no small bit to the pressure that we saw Ernie apply through his work there. And what he did was test. every summer he'd start testing products with Delmarva, find it, say, hey, we have a problem here again, let's fix it, and kept doing that, and we kept seeing the illnesses continue over about a 10-year period of time. And he did an amazing job of trying to stop it. Another thing about Ernie is when you talk to him, he's like, there's nothing more frustrating to me than when I look at what's happened with foodborne illness over my career. It hasn't gone down. We know more about prevention. We know more how to do a better job of preventing. We know what practices promote illness. We know so much more, but we still aren't being as effective as we need to be at stopping foodborne illness. Yeah, technology is part of that. We can test much easier today. We can find the pathogen and we can link it together like we never could. But arguably, we're not seeing the rates go up hugely, so I'm not sure that that's as much, but there's some arguments there. In fact, I was talking to someone this morning that's an absolute expert on this topic, and he's like, yeah, maybe that relates, but I'm not convinced it's just that. I really think we haven't really done anything to bend that curve. We haven't got there and really started working hard enough to bend that curve. Ernie would tell you the same thing, and he's not afraid to tell his colleagues that. He's not afraid to tell his people that. And he's not afraid to tell the world that we need to do better. So one of the other things Ernie will tell you is, of course he worked for the state, so he had to justify himself to a legislature, or as you might imagine, the city council here in DC. And he always would say, I would always ask how many inspections I got done. That might be the wrong widget some days. That might be the wrong thing to count. He's like, truthfully, what am I really looking for is, verification and systematic correction of those known problems. He's like, I can justify to the legislature any day that I didn't get to the next place on our list to do, but I can't justify not making sure that something got fixed. Think of that practical common sense approach and how you could apply that in your operation. That becomes very important. If you know something isn't working, we have to change the system, make sure we've corrected it, and make sure that it's not going to reoccur, right? Very simple sort of principles that Ernie was teaching through his work. So I'm going to move, because I don't want to make you late for lunch, into a couple things that everyone always asks me. And they always ask me to take out what I call our regulatory crystal ball here, about what's coming next and what's going to happen in the retail food safety space in the next few years. Well, first, I'm going to venture a guess that none of you have a similar job to what you had 3 years ago. Have your jobs changed fundamentally in the last 3 years in some way? I'll tell you, mine has. I look like a little box that's on the computer screen most days with a little name below it. I never expected that was going to be my day, 8, 9, 10 hours a day. That was a big shift. But for all of you, your staffing challenges are probably greater than they were. Your supply chain has huge challenges. Probably, what you could get yesterday and what you can get today may not be the same things, which makes your menu very challenging, along with, if you're trying to do things like allergen labeling, etc., becomes more challenging as you have to substitute out products, because there are odd things that come in that product sometimes. So, with that, we must recognize, that things do change. Science change, and our customers change. So let's talk a little bit about some of the things that we've seen over the last few years and that we're probably going to continue seeing. Well, I'm going to give you a hint. I know we just had an allergen added. We're probably not done. We're still a little bit behind the world on the industrialized world on declaration of allergens. We probably have some more coming in the not so distant future. Of course, sesame was the most recent addition, not all that long ago. But we'll continue seeing, I suspect, more allergens added, probably 2 or 3 more over the next few years. So that's something to watch for and be aware of. And don't be shocked if customers ask you about additional allergens that aren't the ones that are required for you to have awareness of in the food code, because there are a lot better awareness amongst customers of allergies and their challenges that they may have with food, with various foods. Talk a little bit about the supply chain. So first, the food system is much more consolidated. where we used to have 10, 20, 30 suppliers that were major suppliers in an area, now we might have 2, 3, or 4. Things that we never would have expected impact the food supply chain now do. So I'm going to give you an example here. During the pandemic, people drove less, right? A lot of people weren't driving to work. A lot of your establishments may not have been open in the traditional format. So people drove less. That impacted something in the food supply that we would have never expected. So a lot of products that you use have CO2 in them, right? All your carbonated beverages, beer, other things, sorry, no, there are many other things, along with a lot of food packaging relies on CO2. So do you know where we get most of our CO2 from and what it's a byproduct of? Ethanol production. So when we stop producing ethanol, all of a sudden we hit a huge issue and, hey, I need CO2 and I can't get it anymore. What's going on? So we have become extremely efficient in letting nothing go to waste. But that also means that we have a little more we have a little more weakness in the overall supply chain because we are dependent not only on our food products, but we're dependent on other products that actually make the byproducts that become our, part of our food supply. So think about that. That's different than it once was. The other thing is, do you have as much choice in products as you once did? Is it harder? I mean, it seems like there's a few players that have a huge portion of what we do. Talking to my colleagues across the country, I hear the very same thing, whether they're operators, brands, or grocery stores. They're like, yeah, I can't buy from as many folks because there just aren't as many places that exist today, and it's much more consolidated market. So think a little bit about supply chain, and you're going to need to have plans in place. What happens if I can't get what I was looking for in my normal product? How do I change my menu with that? How do I do things differently? How does that impact allergens? How does that impact our product and our quality? So definitely be thinking about that going forward. I'm going to say something very scary. In the new world, because of the supply chain issues, my bet is overall we're going to see a reduction in menu size. Now, don't tell my dear friend at Cheesecake Factory that. Okay, come on. Some of you have seen that menu. It's a book. And he is and Dr. Al, who's their food safety director, is a dear friend of mine, but I pick on him about it constantly. That probably is not practical, largely due to some of those supply chain challenges, staffing challenges, right? Can you teach people how to make 140 different dishes if you don't know if you're going to have them there next week? No. So you're probably going to have to rethink that menu a little bit and consolidate it to your core things that really are the core and essence of your business. You know, I'm going to use a brand, so no one throw anything at me. And if there's someone from McDonald's in the house, has McDonald's brought back everything that went away? There are still things that are gone. All-day breakfast is not universal anymore. It's pretty much very limited in a lot of parts of the country, largely because of staffing issues. They weren't able to bring back everything that they once had because of those challenges. So definitely think about that as you're working on your menu. Sometimes more is not better. Sometimes you can do better with less. And of course you have to do this within your business, but be thinking about that a little bit. So another thing that's not going away is delivery. You know, we all remember the days where we could get two things delivered. We could get pizza and Chinese food. Those were the two standards across the country, everywhere. You could get, even in my little town where I grew up of 3,000 people, I could at least get pizza. I couldn't get Chinese food, but that's a whole nother issue. But, you know, that's something that I anticipate this is not going to change, and I think you all know that too. While it won't be like it was in the height of the pandemic where it is everything that you do is delivery, delivery is here to stay. Consumers have really come to like getting things in their homes very quickly, and it works. I mean, when you think about it, if you're a consumer, why do you like delivery? It's convenient, right? I don't have to cook it, they bring it right to me and I can be done. And it takes somewhere under 35 or 45 or an hour. It's a pretty good deal, really. That's not going away. We're going to see that continue. We're also probably going to see it become more novel. The day of the drone and the robot delivery is not far away. We're already seeing robot delivery in some college campuses, large hotel complexes, and that sort of thing. So it's a matter of time before we see that in broader communities as a solution. So just be aware, delivery is something to think about. But along with that, you're also going to need to think about how does it impact the product that we're producing, and how do we continue, and I'm going to say safety-wise, but quality-wise, because both impact it. And then the other question goes back to supply chain. With packaging being so limited and hard to get, how do I preserve my quality for that delivery with the packaging I can get? I know I see some of you thinking about that, because that is a hard thing, because packaging is often designed for the product you put in it, right? You want certain qualities where you're going to put French fries. You want a different quality where you're going to put other products. So French fries is near and dear to my heart, as you probably can tell, but that's a whole nother story. Another thing that we're going to continue to see in the future is the home-based food businesses growing and becoming more and more challenging and trying to go in different areas. We've seen constitutional amendments across the country, laws across the country that say you have a right to produce a food in your home, regardless of if it's safe or not. Those sort of things we're probably going to see continue regretfully, and it's not a good thing. Now, the challenge you're going to get is your friends and neighbors that are trying to produce those things are going to try to convince you that, oh yes, you should feature them in your kitchen, which you should not. Sorry. Hopefully the folks from DC will not disagree with me. I'm just going to say you should not. And there are safety reasons to that. There's also regulatory reasons and lots of other reasons. But be very careful with that. But we're going to continue to see that happen. I have a little bit of good news. There aren't going to be a lot of huge changes in the food code. We're really seeing very small changes from addition to the food code. For all of you that have been waited with bated breath, I hear the 2022 food code is near ready to be published. It's just going through the final clearance process. I'm told it'll be hopefully in your Christmas stocking. So hopefully by the winter holidays, we'll see that actually released. So it is coming, and it will be the 2022 edition. That's at least what we're hearing. But overall, when you think about the last several editions of the food code, we're not seeing a ton of changes. So one of the questions I get, and I suspect with you all being in DC, you may have operations that are in Maryland or Virginia or nearby also. So one of the common questions I get is, why does everyone not use the same version of the food code? It's a great question, isn't it? Well, we would love that to happen, but as you might imagine, there are differences of opinion about the food code. There are some local businesses that might not support everything that's in the food code. Why does California have a state law that says you have to allow bare hand contact? There was a difference of opinion with industry and the food safety folks about that. And the legislature made a determination that they were going to take the risk and allow bare hand contact. Not a good idea, once again, but they do allow it. The other thing is, it's not exactly easy to update a food code, as I know our colleagues at DC Health can tell you. It takes a significant amount of resources. They would normally spend time working with the stakeholders prior to adoption, have to train their staff, they may have to update IT systems. So all of those things take time. So sometimes you might say, hey, not a lot of changes in this edition, I'll wait for the next one, type thing. But don't be surprised about that. So that's one of the things. We see very similar things with manufactured food regulations too, because oftentimes there's literally no change from CFR or Code of Federal Regulation to the next edition of Code of Federal Regulations. Okay, so let's talk a little bit about one other thing that's very important. First, all of you get an A today because you're doing it right now. I would argue one of the very important things you all as operators can do is build those regulatory relationships. Being here at this task force meeting is just one example of building those relationships. But being here and having those informal discussions with the folks from the health department and building those relationships for when maybe something doesn't go right will make that event that doesn't go right go much better. The other thing that I would tell you is it also helps when you're thinking about doing something new. So anyone tried anything new in the last 3 years that was pretty out there? I can tell you, I've done it. I've watched restaurants that are adding robots to the kitchen. That's pretty interesting to me. Seeing some new interesting products coming out that are pretty different than before. Also seen some different methods, some pretty interesting packaging. Not that the food code gets into packaging too far, but it does get on the edge of that. So there's some pretty interesting things happening. But when you have that relationship with your local inspector and the health department, before you do something like that, you might just want to say, hey, I'm thinking about this. What are the implications of me doing this? Am I forgetting something? This is what I think it's going to do to my establishment. Is there some other risk that I haven't analyzed? I would always say that they can be a resource for you, and think about that as a resource. And as a food safety partner, their goal and your goal is exactly the same, that you all produce safe food. I would also say that, keep that engagement going at all levels, and whether that be the inspector and the leadership level, that becomes very, very important. So I'm not going to spend a whole lot more time on that, but you're doing it right here by being at this task force meeting. I would also say, if you have multiple operations, don't be afraid to ask for a meeting with the local health agency to talk a little bit about what you're doing and what's coming next and those sorts of things. Most agencies are very receptive about that and very interested in learning before the fact. So now I'm going to give you the most important part of the day: how to work with regulators 101. So how to have a good inspection in some ways. So, and I'll tell you, I expect almost identical things from the inspectors in the field, no matter where they're at. So the first thing is, everyone should be respectful to each other, right? We all have a job to do. We're here to learn about what you're doing and verify what's happening in your operation, but we all have the same goal. So just being respectful is important. Make sure that you're providing accurate information. Oftentimes, our inspection starts going awry when someone doesn't exactly know what the process is and starts making it up. That is never good, and that often ends up with a challenge later. So if you don't know what's going on, say, hey, let me get the expert and let me see if I can't find someone that knows more about this than I do. Definitely don't hesitate to do that, and make sure what the information you provide is accurate. I would remind you just again, everyone has the same goal here, which is safe food. And lastly, your inspector is never going to be the expert on your establishment. You are. You know what you're doing, you know what you're producing, and you're the expert they're relying on to tell that story while they're in that establishment. Because they're generalists, right? Today they might be at your restaurant, tomorrow they're going to be at your neighbor, and they may produce exactly the opposite types of food, right? And they may use very different techniques. So I just say it's very, very important that you use that opportunity to help educate them and teach them about the establishment. One other tip is, if as the person in charge you're not going with the inspector during the inspection, you're missing a training opportunity for yourself. Best way to learn is to really join the inspector, and don't be afraid to ask a question or two. Why are you doing that? What are you looking at? And hopefully they're spending time in there watching what your folks are doing in the kitchen and asking questions, because that's the best way to verify those things that I would argue could really cause foodborne illness. So those are just a few things there. We got a couple others. One other thing I would tell you is, don't call the mayor when you're unhappy with an inspection result, or the governor. That is not your first spot. If something went wrong in inspection, start with the inspector's supervisor. Oftentimes it can be resolved at that level, and it may just be a misunderstanding, or perhaps there wasn't great communication that happened. So definitely try that. The other thing is, don't bring up your complaint many days later. So if you have a concern about an inspection, bring it up right away. While there's still some amount of information available, while there's still some memory of what happened. I would also say the last thing that I would call a key tip is, before making huge changes, it's always worth reaching out to your regulators and talking to them about what you're going to do. And then finally, ask lots of questions. If you don't understand, it's very important to do those questions. Kind of hit on this already, but I'm going to hit one last thing. Here are some things, once in a while we have an inspection that you might disagree with. So I would say, here are some key things. Approach it constructively. So as a learning opportunity, and don't be defensive. Hey, I don't understand this. Could we talk about it? Is much different than, you marked this wrong. Do you think you're getting a different a different attitude? Yeah, probably. So let's have a constructive conversation. Be prepared and have evidence. Be able to explain what you're thinking about. I'm going to tell you that it's harder to dispute what people see, hear, feel, etc., the observations, than it is to say they misapplied the law. So if it's an observation, you're probably not going to be successful. So think about that very hard when you do an observation argument. Once again, present those concerns as soon as possible. If possible, pick up the phone. An email is very hard to craft in a manner that's easily understandable in this situation. And if you do pick up the phone, follow up with a written communication. And then respond on how you're going to fix what the inspector observed if there is indeed a violation. So with that, I think I am out of time, and I'm going to stop there, but I would love to take a couple minutes of questions if anyone has any questions or thoughts. I can see you all again. That's awesome. Oh, come on. I know I'm between you and lunch, but it's a hard spot to be in. Well, hopefully this little tour that we just took into food safety was interesting to you all, and I would love to talk more with you, and hope we can talk again soon, but definitely take some of those, choose one or two pieces of what we just talked about and take that back to your establishment. And I hope it's really working on that culture and ensuring you have a culture that's really meant for success. And I'm going to argue if you have a good food safety culture, it's probably going to translate into business too, because that'll carry throughout your business and it'll make your staff exceptional and your operation exceptional. So with that, let's all go home and have a great food safety culture day. Thank you.
Okay, guys, before you guys head out to lunch, I'm gonna call two of the tickets for prizes. Everybody got their tickets? Okay. First number is 361020. All right, let me try it again. 361017. No? 361009. No? 361018. Oh, finally. Right? Here, you go. No, get Thank you. So this is our body fluid spill kits. Oh. Thank you. Let me take a picture. Oh. Thank you. All right, one more. Three, 361-003. Oh, we got one more. We got it with us. All right, another body fluid spill kit. You're welcome. So we're gonna break for lunch, come back at 1:15. Please come back, we've got some great, we have one more presentation that's gonna be virtual, and then we're gonna do our breakout sessions. Thank you.
put those on up there.
And take yours.
Yeah.
Okay. Are these reading?
Yeah.
Okay.
Economic, legal, ethical, and philanthropic responsibilities of any company, not just within the food industry. At the same time, when we talk about employees and about consumers, we can look at the Maslow's hierarchy of needs. Many of us are familiar with those. Maslow's hierarchy of needs holds that we have physiological needs: air, shelter, water, food, sleep, and survival. That we have to meet before we can focus on our personal, financial health and well-being, and before our social needs, our esteem, and self-actualization. So we look at the idea of where, in terms of our employees and our consumers, those very survival and safety and security needs are primary, and yet most people will associate food safety not necessarily with economic, and in many cases not even with legal. They'll think of it in terms of ethical. So it's not necessarily a primary responsibility that we see within industry. So I bring this up because when we look at these other kind of responsibilities that are being placed on industry today, when we look at sustainable development goals, a more global set, a blueprint, if you will, for peace and ending poverty and other deprivations across all nations, people are collecting information about this too. And many argue that all of these 17 goals pertain to food. Additionally, we look at ESG, environmental, social, and governance, as a way to measure a company's behavior and their risks. These are used by investors and other stakeholders, and look at everything including product responsibility, child labor, regulatory compliance, things of that nature. So there's a lot more than just food safety data to be looked at today in terms of research and economic analysis of the food industry. And at the same time, there's many more opportunities for looking at red flags. There are opportunities to look at corporate social responsibility, look at even ESG and ask, okay, if there's risks not being met here, or if there's concerns here, do these apply to food safety? And in terms of risks, here's a very generic model that looks at the idea that after an incident, even after it's public attention, and we have a crisis, historically, while there are companies that will take action right away, the bulk of companies won't actually take action to reverse their protocols or policies, whatever's going on, until there's changes in legislation or litigation, essentially court cases. Over time, options to mitigate an issue decrease, while liabilities increase. Now, what we have seen more recently over the past 3 decades is that the element of social media is now creating a scenario where consumers are thought more of as stakeholders within the food industry. Social media has pressured industry to take change, to take the opportunity to make a change and tolerate risk less when it comes to food safety. Now, of course, this means that if they're taking change earlier, then they're dealing with more options and they're limiting their liabilities. But we can also look at technology in terms of the idea of how can technology be used to be predictive? Can we find evidence and issue before something becomes an incident that catches public attention? Can we maximize our options before we even have liabilities? And even the idea of using all these different sources of data, Internet of Things, artificial intelligence, to maximize the value of these resources while decreasing our costs and liabilities. But you notice we talk about the idea of public attention. It's important for us to look at how media has changed over time. We know that the different media outlets sit at different places in a curve of bias. We know that when it comes to food safety issues, that different newspapers and magazines will approach it from either the national desk or the business desk or maybe the crime desk or food desk. We also know that over the past 3 decades, there have been many newspapers that have looked at in terms of food safety and the work that health departments do. You know, I mentioned that 1993 Jack and the Moxie Coli outbreak, and if we were to take a look at some of the headlines from 1993 during that outbreak, what we'll start to see is a pattern here. This is a brainstorm word capture kind of a cloud where it looks at the bigger the words are, the more often it's found in national newspapers. The New York Times, LA Times, and Washington Posts of 1993 looking at the Jack in the Box E. coli outbreak. But we know that there's more to this story. We start looking at other newspapers, other headlines, other images appear, other stories appear. These are articles about the fourth child who died during that 1993 Jack in the Box E. coli outbreak. He is my son, Riley, who at 16 months of age became sick due to exposure to another child at his daycare center who had tested positive for E. coli. The media images includes images of my son being put on a cart and taken by helicopter to Children's Hospital, where he underwent exploratory surgery and was placed in medically induced coma. It was very hard to find his body in the sea of wires and tubes and equipment that surrounded him. But seeing him being outside again, carried in the world's smallest coffin, is not the way that anyone should learn about E. coli. The newspaper headlines of this time, though, start to differ when you look at the local papers, the Seattle Times, the Seattle Post-Intelligencer, the Bellingham Herald. The keywords in those articles started to focus on things that were less generic, less corporate, less national, and focused more on areas of family, community, threat, and public health. So it's important to note that there is a very good history of research that looks at the difference between national coverage of an issue and more local coverage of an issue, and which one is more likely to have an impact not only on consumers, but even on those who are working in the food industry in areas impacted by an outbreak. Beyond news, we look at social media in many different ways. Not everyone uses social media in the same way. Some are just at the higher levels. They are just looking, they're following, they're subscribing, they are just fans, followers. They're more passive and beginning to be active. And in these examples, we can look at the idea of looking at web pages, memes, social viral videos, political cartoons, going to Facebook discussion groups, going to online news sources for information and resources about food safety. I used to look at memes as being of bad taste. Like, how dare someone make fun of something that someone's going through and it's the worst time of their life. But I do look at memes today, these kind of viral images, as being a finger on the pulse of the fact that someone would not create these and send these if they didn't assume that their audience, their readers, knew what they were talking about. So there's got to be a way of looking at this and seeing that these wouldn't exist if consumers didn't know about these issues. But there's also consumers who work on a completely different level. They work more in terms of more active and even generative. They're loyalists. They're even advocates when it comes to, in this case, food safety. We saw with the pink sauce and with the Daily Harvest crumbles, here were two non-traditional, not brick and mortar. This was directly to consumer distribution, where these food companies were using social media influencers to get the word out about this and to build instant trust. But the reality in both these cases is that it more than lost their trust. Social media influencers were taking to TikTok and web pages and Facebook and different platforms to talk about their experiences of being sick, vomiting, diarrhea, gallbladder surgeries, raising food safety questions and being very critical of these once instant trust, if you will, but now not trusted in terms of when it comes to food safety. We can also see how this applies to ghost kitchens, third-party delivery, and meal kits, where again, there's a lot of social media activity that is showing how consumers are calling them scams, they're looking at being health risks, they're sharing their bad experiences, and they're really being this kind of eye on the idea that perhaps social media is becoming a platform not just to learn about food safety issues, but also to generate information and even influence others and help people better understand when there are issues, concerns, and breakdown of trust when it comes to these. Further, when you look at Amazon reviews, Yelp reviews, and even consumers who are using a website called iwaspoisoned.com, which is crowdsourcing of bad food safety experiences, we see an increase in identifying unreported cases, identifying unreported or undetermined outbreaks, but ultimately the idea of data mining and analytics information, allowing researchers to improve food safety based on information that's generated from consumers. So we need to take this into consideration when we look at the idea of the messages we give to industries. The idea of the local restaurants, the chain restaurants, anyone we're talking to, that we always need to prioritize food safety. Essentially, it's not food unless it's safe food. You know, we don't say things like it's not a safe car, but it's a car. It's not a safe airplane, but it's an airplane. We want to make sure that food safety is always prioritized. And we want to make sure that companies are investing into whether it's third-party audits, additional inspections, technology, transparency, things of that nature. Finally, training. We hear a lot about incidents where they say in response, oh, we're going to make sure that our people are trained. I want to make sure that companies start responding such that they talk about their executives, their higher level leadership is also going to go through training. Because unless there's training at the top levels, you're not going to have the prioritization and the investing all the way through. And quite honestly, we don't want to wait until after a major outbreak or recall to hear these sentiments being communicated by a company, because this is the wrong time to start building trust on what should have been done all along. You know, in 1906, we know about the jungle. Many people have read it or are aware of it. But the literary review conducted by and printed by the London Daily Times in June of that year discussed the book and stated that the things described by Mr. Sinclair happened yesterday, are happening today, and will happen tomorrow and the next day until some Hercules comes to cleanse the filthy stable. You know, in this day, this modern day of DC and Marvel superheroes and movies and TV shows, I honestly don't believe that we're supposed to invest our hopes into any one Hercules. But perhaps what is really meant is this idea of a change in how we think about this. You know, many years ago I met up with a family. Their son had actually been sick with E. coli, was on dialysis, went through a stroke, and lost the use of his arm. Many years later I met up with him again, and the mom handed me this picture of a superhero in flight that her son had drawn with a crayon. And she told me about talking with her son, how her son says that he wished he could play like the other kids in the playground. At the same time, he wanted someone in the food industry, someone out there to have said something or to have done something to have prevent this from happening, to have made him safe. And he said that that person would be a superhero. He didn't draw someone in a suit coat or in an office behind a desk with a name tag or with a beard net or a hair net. He literally drew someone like a superhero drawing that we would see today. And I think that this is important to look at this idea of Hercules really refers to Herculean effort, an enormous amount of work, strength, and courage. And while technology can help us with our work and strength, it takes way more than just technology to focus on the courage to attend training, the courage to prioritize when it comes to return on investment or cost-benefit analysis. The idea of those messages we share when we do inspections, when we have the opportunity to make a difference in food safety, we have to make sure that we have the courage to do that. I want to thank you for your Herculean effort that you put into food safety with all that you do, and if there's time left, I'm more than happy to answer questions. Thank you very much.
Thank you so much for your presentation, Dr. Detweiler. We really appreciate your contribution to food safety. And yes, we'll be sending further questions from the audience. Once again, thank you so much, sir.
Thank you very much. And again, thank you everyone for your Herculean effort to make our food safe.
Thank you, everyone. I hope you all enjoyed the last presentation. As far as I know, we are going to be moving to a breakout session, so you can get up and walk around. Now your belly's full. We don't want you all to sit here and go to sleep. So, according to the agenda you have in your packet, you should have a document showing the afternoon breakout sessions. And I didn't get any further instruction, but as far as I know, I assume you can select one and just adjust yourself accordingly. Thank you so much.
Question and answering session on the topics of basic business license and mobile vending. So we're going to primarily talk about basic business licenses as it relates to food operations and what it is that we do. Of course, there are several business licenses that one can obtain. I just want to preface everything by letting you know that DCRA come October the 1st will be splitting into 2 different divisions. So you would want to at least go to their website and check out some of their new things that they're going to be undergoing so that you can know where to go to, okay? This piece of information is basically the steps that you need to take with DCRA in order to apply for a license. That particular process is still going to be the same. You want to register your corporate name. You want to also register with the Internal Revenue Service in the DC Office of Tax and Revenue. And you also want to register with the Office of Zoning. We're talking about all stationary food facilities, okay? And then you're gonna apply with them for your basic business license. These things should be done prior to you coming to our division. But we just wanted to highlight some of those things that you would need to do for that. This is the most important piece to the first step for us, is we need to receive what's called a certificate of occupancy. Okay, we need that in order to know what you're going to do. So it's required of all stationary businesses. Okay, as it relates to our particular operation, it's required for all commercial facilities to do a certificate of occupancy. For all home businesses, such as like our cottage food license that we're going to talk about, a certificate that we're going to talk about in a minute. It's a home occupancy permit that you're supposed to obtain. And any businesses that are located in a government building, you're going to get the federal government's equivalent to a certificate of occupancy before we can do anything like an ownership change or anything like that. New businesses, we actually have a plenary session that's going to go on, and they're going to talk about brand new businesses and what other requirements are needed. With regard to a business license for all of our lovely food categories, unfortunately, we don't we didn't make these categories. We made them, but we didn't make them. They're kind of etched in stone right now. So it's some things that we regulate with great frequency and others that there's really not a lot of them in our purview, but we have bakery, we have candy manufacturer, caterer, delicatessen, food products, public school cafeteria, grocery store, ice cream manufacturer, marine food, mobile delicatessen, food vending machine, and restaurants. The plan review section can get into the nitty-gritty of what each one of these categories would require. However, you'll notice that we have two manufacturing categories, and one of the things that I wanted to highlight is that those are the only manufacturing categories that we have now, as opposed to a general manufacturer. There are other types of manufacturing operations, but we're currently categorizing them under a catering license for now. And we kind of explain that whole reason why to you when you apply, but it's still a manufacturer. How do you request an inspection? Well, we have this brand new portal that you can go to and you can request an inspection, whether it be, I need an inspection because DCRA will not issue our license without a brand new inspection, or your ownership change, or you just feel as though you didn't have an inspection for quite some time and you want to be inspected. We have on our webpage a portal where you can actually do an inspection request form, and then those requests are delegated to all of the units within our division that will handle it. Like if you need an ownership change, inspection of that, it'll get given to our plan review. If you need something for special events, it'll be delegated to someone. So it'll be delegated and handled that way. Okay. One of the things that I can say about the business license process is that it's totally online now. Just like our application process is now online, we're trying to, the pandemic has really taught us a very valuable lesson on other means of obtaining those same pieces of information without making you physically come into our facilities to do so. We can handle things remotely, which allows you to have more free time to do other things with regards to your business or any other things that you have to do with managing your time. That's one of the things that you don't have to do. So both DCRA, soon to be known as two other entities, come October 1st. And I'm so sorry. That is the computer that was having a Teams call in the background. So sorry. So, yes. So, we have definitely come into the new age where we too are starting to provide services that save the consumer time, that saves you guys time. All of our application processes are also online, so you no longer have to take a trip down to 899 North Capitol to submit an application. You can submit an application, and we're going to have another breakout session that goes over that whole portal, because that's another thing people are confused with. You know, with new innovative things, there are glitches, and it just takes time for people to learn the system and all the glitches to be removed from the matrix. So mobile vending, what are the requirements? Basically, we receive mobile vending applications from 3 different situations. We have renewal applications that don't require a license renewal. Our renewal period for our health certificate that is issued once approved through our department is every 6 months. However, DCRA's licensing period is 2 years. The reason why ours is 6 months is we want to be able to see you, mobile vendors are mobile, there's not a stationary facility. We want to be able to see and evaluate and make sure that you're doing all the great things that we know that you can do and you're adhering to the food code. So renewals without a license renewal, renewals that require a license renewal, and brand new mobile vending units. So brand new mobile vending units are just like brand new facilities. They have to undergo plan review. Plans have to be submitted for each of those particular units. Renewals require you to confirm and provide your same information, such as your depot, your mobile depot. That's the place where you go to wash, rinse, and sanitize your equipment, empty your wastewater, fill up with potable water. Maybe that's the place that you store all of your food items, use their cold holding units. Maybe you do a little prep in the beginning, and you do your prep work and wash your produce or anything that needs to be washed at your mobile depots. That has to be a licensed facility. Depots can be restaurants that are approved today. It can be shared kitchens. It can be mobile vending. Just depots itself, and that's all they deal with is mobile vendors, and they provide them with the space and the equipment needed to prep everything for their unit before they go off on their operational deck. So whether you're a renewal, whether you're new, everyone has to provide that information, and you have to verify it. New has to provide an actual floor plan of their unit and the specs for their unit, and I'm sure plan review is going to talk in detail what that requires when you're submitting a brand new application. But you have to have the specs, you have to have the mobile vending equipment that you're using, a menu. Everyone has to submit their menu or confirm their menu, because that tells us what equipment you need to have and what it is that you're doing on the unit. Everyone has to have a food safety certified person. So all of those documents are provided, and we are going to review that in our application portal breakout session at 2:45, because we're going to use a mobile vending application as one of the examples on how to use the portal. So you'll get to see, if you're here for that, all of the things that are required that you have to upload. And I must say that one of the differences between the online portal versus doing a physical application is now that when you hand in those documents are saved to the portal, and we'll always have access to it. So we'll be able to see some of those things, like what type of refrigeration unit you have. We'll have all of your information from your original unit, whereas though before it was archived with a paper file document, and it wasn't as easily attainable. So we won't need every single document once we finally get the system underway, up and going. So once it's a paper review, when you have all of the information that you need, all three of them are still undergoing the same thing. They're going to be approved to be inspected. We conduct inspections in 2 places. For brand new vendors that are approved, they're currently inspecting them at DCRA's headquarters. I don't know if that's going to change, but what's not going to change is the fact that that will be a joint inspection between DCRA and our fire code individuals from FINS. They're going to check out whether or not you're meeting their requirements along with DOH. So the 3 agencies are going to inspect at the brand new one. Renewal, once your application is approved and you have all of your information, we also do a physical inspection, but we do it at our current headquarters where we are now, which is 899 North Capitol. We conduct your inspection. If you pass your inspection and all of the documents for renewal have been provided to us and everything's been confirmed, you will either get a health certificate for those that don't need a license renewal, or you're gonna get approval to get your license renewed. Once you get your license renewed and you provide us with that updated information, then you'll end up getting a health certificate at the end. So 2 types of renewals. One will require you to take the inspection report given to actually get your new license and your new employee VEB, vendor employee badge, which currently is not a physical badge like it used to be, like a card. It is now an email acknowledgement that you have applied, and it puts all the information on it until they get to a place where they're starting to issue badges again. But you'll get that, and all that information is used to create your new health certificate. For new vendors, same thing. Once you pass FIMS, once you pass DCRA, once you pass health, we will give you approval to be able to get all of your documents. And once you get your new license, your new vendor employee badge, you're gonna send that back to us, and the end result will be your health certificate. So let's say for some reason your greatness is not shining on that day, and you don't pass the inspection. Well, we schedule another inspection when you're ready. Maybe it was a hiccup and your water pump wasn't working and we couldn't test to see if it was hot water. No problems. When you get it fixed, we do another inspection, and once you pass, we go through the same process. That is the end of providing information, but it is 2 things that I want to leave everyone with before we get into questions from the audience. Yes, before we do that, DCRA is undergoing changes. But what I would like for you to do, if you have a question, I want you to email us at food.safety@dc.gov. If you have any additional questions and you're not present in the audience today, please send us an email and we'll be able to answer those questions and provide you with a contact for members of DCRA who will be able to help you as well. Are there any questions out there in the audience? No questions? Well, that concludes all my virtual people in the audience, all my physical people in the audience. Thank you so much for taking the time to listen to this. I got applause. Yes, thank you so much. You have a wonderful day.
Thank you, Ms. Vaughn. Okay.
Okay, thank you. Good afternoon, everybody. I think we're going to change over the presentation for a plan review session. I'm Bruce Flippins with DC Health, one of the plan review officers. Douglas Dallier is the other plan review officer, and I think he's close by. Oh, there he is. So let's talk about the goals of plan review. And one of the biggest ones is to help us not have future problems down the road after you've built out your facility. So we want you to submit plans so that we can go through this and ensure the establishment is built out according to the current DC food code. We want to make sure that you have a good flow for your restaurant of operations, and make sure that you have the equipment that, you your menu is what dictates the equipment you need. So we want to look at the menu and see that you have all the equipment that you need to support that menu. And again, this is going to eliminate, hopefully, some code violations prior to construction. So we have drawings, shop drawings, and supporting documents. So our drawings are signed by a registered design professional, and these are the ones that are going to be submitted through DCRA, and have to be signed and stamped by a registered architect or professional engineer. Shop drawings are not signed. We get a lot of these with the food trucks, just so that we can get an idea of what's going on with the equipment. But this is still effective for us so that we can tell you what to correct ahead of time. Supporting documents. The menu drives the plan review. So if we don't know what you're serving, we really can't go through the process of determining what equipment you'll need. So if you have a restaurant and you start to open a restaurant up and you don't know what you're going to do yet or what your focus will be, it's not really entirely helpful to us, so that we know that whether or not you'll need ovens for baking donuts or pressure fryers for frying chicken. So we need to know what you're planning to serve. We have a DC Health guidance packet that we provide also for you to submit to us. And this guidance packet tells you what the plan submitted. And also, if you go through and read it, it answers a lot of questions for you that you'll likely have ahead of time. And equipment specification sheets, and I think we have an example of a spec sheet up here somewhere. The equipment specification sheets are required for each piece of equipment in your establishment. And what we're looking for here is a sanitation rating on the equipment that lets us know that it's rated to be used in a commercial food establishment. And so that's an NSF rating or ANSI rating, but there are other regulatory agencies and national regulatory agencies that we would also take into consideration for as well. And as I said a moment ago, the menu drives the plan review process. The prep process is as important as the foods. What are we, how many steps are we taking when we're preparing food? Is it a cook, chill, reheat process? Is it a cook for immediate service process? And so our menu is going to let us know that, and we're going to know that based upon the equipment that you need, what you're doing. So we have a basic menu here that and this looks familiar, but you know, it's somebody that we know. So our guidance pack is one of those. There's the guidance pack to complete and signed by the. Well, we want it to be signed by the person running the restaurant. A lot of times we get it from the architects, and I'm like, well, you know, it's not really your place to fill this out because you don't know the operation the way the operators do. So we want them to do that. Is it a seating, carry out, or caterer? And when we're looking at this, you know, if we're looking at caterers, what we want to know, if you're going to be a catering operation, what equipment do you have to transport food to your catering operations that keeps it either hot or cold? What's your plan when you get there to reheat, whether that's sternos or bain-maries? What times, dates, and meals are served? That tells us how much storage space you're going to need. So if you're saying that you're going to have these many meals for breakfast, lunch, and dinner, and you're going to get deliveries, once a week or once every other week, then how much storage space will you need in cubic feet in terms of your walk-in refrigeration units, in terms of your dry storage space? So we take all this into account. Most people have enough space, but we want to look at that and verify it as well. And what are the food preparation processes and the plan for trash? So we talked about the food prep processes. How much food is being prepared in advance? What's your processes? Are we doing the par-cooked chicken, cool, and then re-cook, complete the cooking process up to 165? Are we cooking, cooling for service the next day? And our plan for trash is that you have to have a trash contract, a trash removal contract from a company that's licensed in the District of Columbia. And we want to see your trash cans and your dumpsters in the back when you come and do an inspection. This is an example of what our guidance packet looks like. We scale it down quite a bit. from what it used to be. It could probably be scaled down a little bit more. And I won't take you through all this, but if you can request a copy of the guidance packet, you can send an email to food.safety@dc.gov to get a copy of this. It's also on our website. What are you talking about? So Juan was talking about mobile vending a moment ago. And a lot of this has changed now because there's, again, as you mentioned, that we're doing the mobile vending applications online through our Salesforce portal. But we still want all of the supporting documents that you can add there. Let me go back. And so when we talk about the depot, that's your support facility for your food truck. This is where you're going to take your truck back at the end of the day, clean it out, empty out your wastewater, get fresh water. You can do your prep work at this depot so that you can get your truck set up to go out for operation. So if the depot is in DC, we'll have an inspection record for that location. But if it's outside of DC, Virginia or Maryland, you'll need to submit supporting documents from that jurisdiction with the most current inspection report so that we can verify that they are actually licensed operating. And I'm going to go past this slide because the application does not look like this because we're doing them online now. Okay, so supporting documents, equipment, and spec sheets. So when we look at when we get a spec sheet, we're looking for some of these symbols on the spec sheet. The first one is the National Sanitation Foundation, and that's a process where the equipment manufacturers will submit their equipment to the National Sanitation Foundation so that they can approve it for sanitary use in a kitchen environment, a commercial and kitchen environment, meaning that the equipment is easily cleanable, there's no sharp edges and things of that nature. We probably all know about Underwriters Laboratory, and those are the certifications for our electrical pieces of equipment, which all of the pieces of equipment here would have a UL label on it. The Enertech group is also a sanitation rating for compliance with North America and when we say Canada, Mexico, and North America, and us. Canadian sanitation group there. And then we have a couple more with the baking industry. So we see this equipment, and the equipment themselves will have one of these symbols attached to it, so that when the field inspector's out, he's also looking for this. But before we get to that point, with the plan review, we're looking at the equipment specification sheet for these markings, so that we can say, yes, this equipment is going to be approved for use in your facility. And here we are, just a piece of equipment here. What is this, a deep fryer? But again, it has the NSF sign here, and it has other symbols that we're looking for safety. And also, when going through plan review process through DCRA, the fire department will also be looking at some of your spec sheets to ensure that they are in compliance as well. So NSF is the most important one that we're looking for, and ANSI is the, I want to say, American National Standards Institute. And again, so we're looking for these symbols on all of the, and of course, you know, when you have a restaurant and it's a, you know, double level restaurant and it's got 3 different kitchens, there's a lot of spec sheets to go through. So again, I'm clicking through quickly and I'm looking for these symbols. And so, and then if I have to come back later to look at a piece of equipment that I don't know what it is, that's another part of the conference. But first of all, I like to know that you can even have it before we go that far. Is there a question? Did I miss something? Again, we're still talking about spec sheets, and this one here is classified Underwriters Laboratory, and EPH is Environmental Public Health sanitation rating as well. I'm going to skip some of these. All right, so when we're looking at the drawings, we want to know what the floors are, the walls, the ceilings. And I think that someone earlier, we had a presentation where they were saying when we're doing an inspection, when Doug and I are doing an inspection, our focus is the floors, walls, ceilings, and the equipment. We want to know what you have and what's there. When our regular sanitary inspections go out, we want them to be more in-depth because they're going to be there a little bit longer to see what the operation is doing and it meets their needs. But floors, quarry tile, ceramic tile, sealed, curved concrete. One of our biggest issues here now is making sure that they are properly coded. And this is for sanitation. We don't want any 45-degree angles there in the kitchen because that is where you will often find listeria lurking if you're not cleaning properly. So the drawings that we get, I prefer to get food service drawings in with the blueprints because it just takes me right to that section that I need to see. I want to see the equipment layout. I want to see the equipment schedule that corresponds to the equipment layout. And I can just run through the places by operation. And I'll take a plan and I'll show you how I run through mine. Plumbing plans, for our minimum equipment, for bars, all bars are required to have a 3-compartment sink and a hand sink, or a 2-compartment sink, mechanical glass washer, and a hand sink. And if you have one of those 2 configurations behind your bar, I don't care what else is back there, but this is the starting point to get the bar approved when you're looking at them. Kitchens, at a minimum, you'll have 2 hand sinks in the kitchen. You have to have a dedicated hand sink for your dishwashing operation, and then you're going to have a hand sink for your food prep and cooking operation. And sometimes cooking and food prep can share a hand sink, depending on the scope of what we're doing. But when I look at blueprints, and I hope that I've expressed that to Doug as well, that we assign hand sinks by operation, not by distance. And I know that, and I get this a lot, and it's a small space, and I know that can be an issue sometimes. But what we've learned is that the people who are basically washing dishes are not the same people who are handling food. And this is how we're going to minimize the potential for cross-contamination, people getting sick, is by not having everybody have a hand sink in the middle of the room saying, well, everybody can get to it. And I want to ask you, you want the guy who's making burger patties all day to share a hand sink with the guy who's making salads all day? And I think that probably answers his own question about why we are looking at hand sinks per operation and whether or not you need them. Front service counter should have a hand sink as well, and maybe not a dump sink. And then we're looking at the mechanical plants, type 1, type 2 hoods. Type 1 hoods are the ones that are plumbed directly through the roof all the way up. I think it goes about 25 feet above the roof line. It sucks exhaust out. Your type 2 hoods would probably be the ones that we can think about, the ones we have at home. They just kind of recirculate air and kind of, I guess, clean the smoke out or sanitize it. They try to minimize odors with the type 2 hood. It's not really taking exhaust out of the building. And so depending on what you're cooking, that might be appropriate for your operation. And if you change your operation later on down the road from just doing cookies, and now I'm doing cookies and I'm doing a maple bacon piece to go on top of my cookie, that was what we agreed to initially. And so you might need to reconsider what you're doing. So this is a small plan. I haven't seen this in a minute, but I'm going to go to the other side and tell you what we're just looking at. I'll say the bar plan on the bottom here. We have a 3-compartment sink in the middle. Is there a pointer on here? I don't think so. We have a 3-compartment sink and a hand sink. So I'm basically done with this bar. Now, they have other refrigeration units here. They have that stuff. When I get to the plumbing pages, I'm going to look at the plumbing for the bar. Eventually, the 3-compartment sink that has indirect waste. We're going to look at the finished plan to see what the material is, and for the coating and the sealing plan. But that bar has all the equipment. We'll start with that piece. And we're going to look at the top, the kitchen bar plan. So at the top left, it looks like a refrigerator. Maybe a sandwich prep unit, a refrigerator there. I see a prep sink and a hand sink next to that. I'm going to come to this side of this bar here, where see there's a hood, the outline of the hood. There's two hoods actually. One is a hood for a bigger oven, looks like a smoker oven probably, and then the other hood is smaller. But you see there's a range there. There's a deep fryer there as well, and all the equipment fits underneath the hood. And next to the cook line, you see there's another hand sink. And then we can look up here in the corner there, that you see there's a 3-compartment sink, and there's another hand sink next to that. And the 3-compartment sink is basically, we would have a disposal unit in the drain for the 3-compartment sink. I think we're moving away from having the disposals installed in DC, but if you have one installed, it has to be installed in the drain board of the 3-compartment sink. It has to be plumbed and trapped separately from all other sink compartments and have its own supply of cold water. So if you have one, it has to operate properly and has to meet the specifications that we talked about here. But if you don't have one, I think we're moving away from that penalty piece of that. I think there's a dishwasher here also, but again, that's kind of far from the see. And I want to walk back this way. This probably is a walk-in cooler. I want to say there's a mop sink there and another hand sink, but I can't really see. It's a little fuzzy for me, but that would satisfy our needs, requirements for a plan review. And again, the rest of the pieces come with this is looking at the mechanical plans for the exhaust in the kitchen, looking at the finished plans for the walls, the floors, the coatings, for the rest of that. Basic plan. Okay, so what we have here is indirect waste from the 3-compartment sink going to an open site floor sink there. So there's been a change in the plumbing code that requires now, instead of it having all 3 pipes going to the open site, we're going to want you to have indirect connections from each basin going through. And I don't, this is an older slide, so I probably don't have the best example of that showing, but if you want to email food.safety@dc.gov, we will send you a current configuration of how we expect all 3-compartment sinks to look as we're moving forward. Is this the food truck stuff? Food truck plan. You want to talk about food trucks? I should talk about food trucks. Sure. I'm going to look at the food trucks. I'm looking at the food trucks. All right, so the food truck plan and equipment finishes as well. Basic equipment for a food truck. Now, obviously you don't have as much room as you would have in a brick and mortar establishment, but nonetheless, I always say, or I got this from one of my former supervisors, if you want to have a restaurant in a broom closet, you got to have all the equipment in the broom closet with you. And the same thing on a food truck. There's only so much that you can do on a food truck, which is why we're trying to limit your amount of hours in the field with that. But again, the food truck's going to have a 3-compartment sink, top left here, a hand sink. They got a refrigerator here. There's a sandwich prep unit, you know, the lift up top pieces there. And on the other side is we have a stove, a deep fryer. They tell us where the driver is. Up top here. That trailer back there? Yeah. That's the trailer back here. Oh, it's not even a trailer. One of those trailers. These are nice trailers. It has a mop sink and everything, I believe. And this just tells us all the equipment that they have on that trail and the specifications that go with it. And then our resources are the food protection recommended guidance for local food establishments, plan review for food establishments 2016, 2017 DCRE construction codes. Have we moved on this? We're past 2017 now, aren't we? No, we're still there. We're still in 2017. DC restaurant permitting licensing guide. That's a DCRA document. FDA 207 plan review for food establishments is an excellent course. I think they offer it virtually now as well for regulators. I don't know if they can let private citizens go. So that's the last of my slides. What do I want to mention about plan review? The whole process of plan reviews in DC starts at DCRA. You'll submit your plans to them first. There's a plan review coordinator that will review your submitted documents and drawings. And after you've gone through that piece, they will assign it out to reviewers to review. So it comes to DC Health Review, it goes to DOEE, it goes to WASA, Water People's Review. It will go to the electrical, mechanical, plumbing, energy reviewers. And we all review the plans concurrently. And after everybody puts in, all the reviewers put their comments in for correction, the plans go back to the customer. The customer is then able to look at the comments from each reviewing agency and make the corrections in the blueprints or the supporting documents. And when they've made all those corrections, they resubmit back for the next review cycle. And then it comes back to the reviewers, and if everything is good, which is in a perfect world it will be, we're able to approve. Everybody's going to approve the plans, and then the client is able to get their building permit. This enables them to start construction. And so, they're either, rushing to start construction, or they're, everybody's about to be laid off because they can't get the plans reviewed. So we try to make sure that we get the plans reviewed. Our food code allows for a 30-day review period. Our program standards wants us to review all plans within 7 to 10 business days. So we maintain that so far. Once you've completed your build out of your establishment according to the approved plans that you have, you can call for third-party inspections or DCRA inspections. DCRA inspectors will come out and they're looking at the plans that they've approved: electrical, mechanical, fire, structural. And once they say that, okay, the building is safe, you'll get a certificate of occupancy. It's a COO, and again, it sounds like this is what it is, a certificate of occupancy. It means that the building is safe for the public to occupy. Once you get that, then you can call for your final DC health inspection, and for pre-operational inspections or ownership change inspections, Doug and myself will come out and conduct those inspections. And again, if you build out your establishment according to the approved plans, you should be good to go. And we don't really get a lot of issues once we get to this point for licensure. I would say that for the most part, there's some minor plumbing things. Somebody didn't do something right with the indirect waste on a prep sink or a 3-compartment sink. But once we come out and do the initial inspection, if you pass, you're able to use your passing inspection report and your certificate of occupancy to get your business license, and then you can get that open to the public. If we come out to do the inspection and you have some corrections to make, minor or big, we would say, okay, we've seen all the equipment in operation. You can come in, you can start prepping, you can start training, you can bring your food in for stocking purposes of that nature, while you get these other things fixed, because we're presuming that it's going to be a fast fix at this point in the game. And then you'll call us back out to see the corrections that you made, and then once we do that final approval, we will issue an inspection report that says no objection to issuance of basic business license, and that will be reflective of your operation, whether it's a restaurant, a delicatessen, or a catering operation, hotel, maybe all four. And that's how you get your business license and able to open to the public. I want to thank, obviously I got 3 people in the audience, but I want to thank the people who are home, because I think there's a lot of people who are virtually doing this. And so again, we want you to make sure that you can reach out to us through food.safety@dc.gov. And I'll just say, if you have questions, please send questions. I have a very hard time extrapolating questions out of stream of thought. That's just me. So if you have questions, ask some questions so that we can go 1, 2, 3, 4 and provide answers, hopefully from the food code, that will answer your questions. Any questions from our team? Yes?
If I have a change of ownership, do you require me to submit any of the stuff from the initial plan review again?
It depends. It depends. If you're, I would say that if it's open and operating, I would say, no, let's just get the certificate of occupancy. What we want to see, what triggers an inspection in my office is a certificate of occupancy. And with that, then we're going to say we want the supporting documents that you would need. Your pest control contract, trash removal, grease recycling, good cleaning contract, employee health policy, vomiting direct response plan, menu, contractors, trash. Yes, so, but if you're submitting plans through DCRA, through Project Docs, we're going to want to see the spec sheets for all the equipment that's there. And it's not a bad idea to go that route, because that way, when we come and do the inspection, you're not shocked that something's missing, or the last operators have taken something away that was approved, or the last operators have been there since 2000, and the laws have changed, and we're going to update to bring you into compliance with the new food code. So the answer is yes and no, depending on what you got. Thank you for that question. Is there another question out there? So again, I'm Bruce Flippins, and my partner here is Doug Dallier, and we're the plan review officers, and you can reach us at food.safety@dc.gov. Thanks, everybody. Oh, here, come on. Yes, yes, yes. There you go.
So once I get the Vanna to my pet Sajak, we can begin this next portion, going through our online portal. I hope you're not recording this part. Good afternoon, good afternoon. For the sake of time, I am going to begin this session on the back end to show everyone all about our online portal system. To access this portal, you can go to our division's webpage, which is at dchealth.dc.gov/service/division-food. Once you get onto our particular website under DC Health, you'll notice that on our main page, not only do we talk about the processing hours, because they have been a little fluid since the pandemic, it also shows the online complaint form if you have to file a complaint on a particular facility, and our online application where you can submit so many different applications such as mobile vending permits, cottage food business permits, shared kitchens, use permits. You can manage inspection and remediation plans for health violations that you have received, as well as certified food protection manager, and so many more, because all of the divisions are starting to use this portal. So When you click on this hyperlink in the middle of the page, you will come up on our application portal. And one of the important factors which you have to keep in mind with every new system, it has to work out the kinks. So if you were one of the first individuals to use our system, we have really improved upon some of the factors within this system to make it run a little smoother, but we are still a work in progress. And with your help pointing those things out to us, we can update the system accordingly to make it easily usable for you and all of your needs. One of the great benefits of having an online portal is it will save time with respect to you having to come physically into a processing center to submit your applications and pay for it. And it will also give you the convenience of either submitting your application at your workplace or at your home, as long as you have the information needed and the support documents to upload or into the file, which can be uploaded in various ways. There's certain files that can't be used, but we'll see that as we go through the process. So one of the first things that you need to do is you need to create an account. So when you come on this page, you're gonna click on Create New Account. Now in creating an account, you must make sure that you create a username that is unique. But let's go through each of the steps. So I'm gonna create a mock account so that you can see each step. I lost the screen. Let's see. Here we go. So you're going to enter your first name. Your last name, and then you're going to create a username that is going to contain a capital letter, a lowercase letter, a number, and a special symbol. It must be at least, I believe, 10 digits long. Let's enter it and see, but it should contain symbol, capital, lowercase, and number in order for you to successfully create an account. You must enter a valid email address because it's going to go through an authentication process in order for you to confirm your email. So select the email account that you wish to use for your account. And I'm going to need to make a correction on my directions. So, I gave you the criteria for the password, not the criteria for your username. Your username should be in an email format. Again, your username should be in an email format, but it doesn't necessarily have to be your email address, if that makes sense. So it's going to be whatever the name is at whatever. So let me change that and let's see how it goes. As I say, glitches in the matrix. We're currently experiencing a glitch. Give me one moment, please. We're going to have to take a second take of this because I need to figure out what's going on with this computer. the system, you have to create a user profile. This link can be found on our webpage, the DC Health Food Division of Food webpage, okay? And the link is there. Once you access the link, you will create a username. As you see, my authenticity credentials are already in there. So we're going to log in, and I'm going to take you on a ride through our application portal to show you how to successfully submit an application. Once you successfully logged into the application portal, you will notice the upper bar has a home page, a submit application link, an application history link, and a support link. When you're just new coming onto this system, you will be submitting an application. And that is, before we do that, that is the only link that we want to do. You'll notice to the right, there's some quick links. Those are not associated with any type of submissions. They're just quick links for information. And they change over time, and update over time. And it may be things like they have a DCRA quick link. So it provides you a place to quickly go for a particular topic that could be related to your submission. So we want to go into submit an application. When you submit an application, as you can see, there are 6 different types of submissions that you can provide. And you might not notice the name of a particular submission, but it is that. So, Certified Employee Identification Card, better known as you can see in the parentheses, CFPM, Certified Food Manager, or CPO for Certified Pool Operator. Let's try to create one of those submissions. So you select and you hit next. So what type of application? Is it going to be new? Is it going to be a renewal? Or is it going to be a replacement? For our purposes today, it's going to be new. What type? It's going to be a food certified manager. We're going to select that type. And then we're going to go to next. Here's where you're going to give all of the new applicants information. So we're going to establishment name in which the applicant works. I'm just going to make up one. And I see my helper is having trouble figuring out what to put in, but this is for one spot. That would be me. And it's on a main street in Washington. But you would place whatever your information is, you would place into this portal. You want to make sure you fill out all applicable fields, because if you don't, it's going to give you an error message, and it won't allow you to go to the next page. Now, I must say all fields are not needed, but most of them are. And it'll let you, the system will let you know if you didn't put something in that's needed. So again, it's taking a little bit of time, just like when you fill it out with pen and paper. You're taking a little bit of time to put that information in, and then you're going to click next. It's obvious something wasn't filled out. Typically, if it's something that's not filled out properly, it'll be a red hyperlink. So I'm not quite sure of what is going on. My email address is incorrect, is it? The correct email address. Okay. Test organization, leave the email the same. So it should be one of the known test organizations. They want you, oh, I got a perfect 100, put your score in. Yes, because I'm a smart girl. And then the date. Next, so that was your information with regards to your food safety certificate received from the provider. That's what that was, so that was that screen. Here is where you can download documents like your food safety certificate from the course provider. So for this application, that's all it requires. He's going to try to find something, but he's not going to find it. Because this is my computer and he doesn't know it very well. So for the sake of this, oh, you have to drop something in. Okay. So he put something into it. But you would put your food safety certificate in there and you would hit next. That's one of those required things. If you did not put your food safety certificate in there, it wouldn't allow you, or a document I should say, it wouldn't allow you to go on to the next page. Now here is where we're going to select whether it's a replacement or first time user, and we're going to hit next. So the beautiful thing is you can pay for all of this online. And at this point, you would submit whatever your payment information is. Scroll down towards the bottom of the screen, please. Okay. You would submit that payment and you would hit pay. Right? But we don't have that payment today. So, what we're going to do is we are going to save it. What's the blue button say? Because I can't see that. Hit next. That's what it is. Okay, so it's letting us know that the transaction failed, right? But for the purpose of this demonstration, I wanted you to see all the fields and the fact that you can pay. And can we see if it's in our application history, please? And it is. So here's the submission. I wanted you to go back though so I can show them information. Here's the actual submission that was just created. And when you create any application, you're going to see the history. Here we didn't fully complete it. Why? You can tell because it's still in draft. If it was fully submitted, if the payment was made, if it was signed off, then it would say submit. When we receive it and we start to process it, it would state the status at that time. So let's try another application just so you can see the fields in it. And you can pick whichever one you like. Let's do a different one. Oh, you're going to pick that. Okay. Variance. So we know variance applications are submitted from all those facilities that do specialized processes. Oh, you're not going to do that? You change your mind? How about we do a cottage food, because that doesn't require a fee. And we can fully submit it and you can see how it is fully submitted. So it's going to give you all of the information on what it is and all the things, documents that you're going to need and are required for this submission. Just like the paper application, it's the same thing. Let's hit next. You're gonna enter all of your information. Now, what is cottage food? I'm sure our plan review gave a great description of what a cottage food business is. It's one of those businesses that does a limited amount of production of food items that are not potentially hazardous, like the cookies, cakes, things like that. Typically sold at farmers markets, but not just farmers markets. So as we make up this mock account, you'll at least see how a fully submitted application will look. So this is something new that you probably won't see on other application submissions. If there's any information that you don't want to show, for whatever reason, you would click it here. You know, don't show my name, don't show my email address. But we're gonna show everything because you're gonna show nothing. Okay, well, we're gonna show nothing, all right. Now here's where we're going to enter the other information with regards to your home occupancy permit that we talked about before in the other session, the licensing session, your HOP. Because every home business should have a HOP. And again, we're taking the time to just go through the application with you so you can actually see what the portal looks like, what is required, and how to move on to completely submit your application. We get a lot of calls with questions about the portal or things that aren't working right for them because they may have selected the wrong tab, etc. But the one thing that I can say about once you create an account, that's your account. So no matter what kind of, you'll never have to do that a second time. No matter what type of application you're submitting for your food business, whether it be for your food safety certificate, whether it be a variance application because you have some type of specialized process, whether it be a mobile vending application because now you've expanded your business on and you want to take it on the road because of the great business you do at your stationary facility. It can all be done through the same portal. All of your application submissions will be listed under your record, and the status of those applications will be listed under your record, so you'll always be able to log in and see what's going on. So I think we've submitted everything. We're gonna hit next. And here's where you're going to, for cottage food, they want to know the different recipes that you have and the ingredients that you use in your food products. So the documentation for each type of application submission is dependent upon what type of application that you are actually submitting. So for the sake of allowing the system to move on, because if you don't upload something, it won't move on. We uploaded a mock. Well, it's actually a real document off my computer, but nonetheless, this is a mock account. And for each category of things requested, we're going to upload something in its place, but when you do your submission, you will upload the documents that it is asking for. And remember, they listed on that first page of the application that you selected exactly what information you needed to have to move forward. So what else does that mean? That means that the computer you're using for your submission should have access to the documents that you need for said submission. And here you're just going to list, this is a list of the food items that actually are approvable for cottage food, a cottage food business. So you're just listing the category that you fall under. And again, no matter the application, it tells you exactly what you need to submit. I didn't know that was $150, really? Okay, so this won't be fully submitted. It was the share application that doesn't need a payment. Okay. So, again, once this is placed in, unless my helper is so graciously putting in a real credit card, since my name is up there, I doubt very seriously it was a real credit card. But, nonetheless, this will be saved as a draft as well. But we demonstrated 2 submissions for the purpose of this exercise to show you the actual application portal. And once we go back to the original page, your home page, and if we can do that, I'll show you 1 or 2 more features on the home page that is useful to know. So right now, I couldn't get through. I didn't know that it cost $150 to submit this application. I want to ask a question about it. Where do I go? I'm going to go to support. I'm going to list the name of the application, and for us, it's the cottage food one, because I didn't know. I had to pay a fee. So you're going to put the information in, your login, your phone number, the category, and these are the categories of issues that you may have had, and case description. What is the problem? Briefly, of course. And then we're going to submit it. That will alert. I put the sound one out. That will alert us that you have an issue, and we can go through, read it, and we're able to respond to that issue in our system. And lastly, if you can go back to application history, anytime you call in for an application, you want to make sure that you jot down your case number, because that will allow us to find the information as quickly as possible. And that is the case number that's highlighted. Okay? So this was Application Portal 101. I hope this was helpful for when you need to use our application portal. Please, 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 if you ever have any questions or concerns, again, you can always email us at food.safety@dc.gov. I hope this session was helpful. You guys have a great day.
Thank you, Ms. Vaughn, for that in-depth detail on how to work that food safety portal. That concludes the Food Safety and Defense Conference of 2022. I just want to thank everybody for coming out. I know you could be anywhere, but you decided to spend the day with us. This will be live recorded This was recorded, so you can view this session, once we get it edited and everything, we'll send out the link via Eventbrite, if that's how you register. If not, you can go, you can email me at joyce.moore@dc.gov if you would like a copy of the entire presentations and everything. Again, I want to thank everybody for participating, especially the Food Safety Task Force, that we have been working diligently. We had some issues with getting our funding on time, but we pulled it all together. I want to thank Jan who wrote it. Without him, I probably would pull a little bit of hair I had left. My program manager, sanitary supervisor, Ms. Fawn, Robin, Megan, Sharon, all of you guys. I just want to thank you guys for stepping up. So, and that concludes our program. Have a great day.